Good morning. This microphone is down. Nobody's hearing. Good morning. Good morning. Okay. Television production, we have take one and then we have take two. A good morning to you all. No, that was so good. A very good morning. It's a beautiful day. It is a beautiful day. In fact, I have a song called Beautiful Day. I want my DJ to play it for me. Let me get the play started because it is a very, very important occasion. We are here. It's the joint launch of
This morning I woke up and I look in the mirror and every part of my body was in place. Many people died and never saw this day. So another day I live, I appreciate. Don't ever wanna act too high and mighty, cause tomorrow I can fall down on my face. So in everything, Lord, I give you praise, and that puts a smile on my face. Lord, I thank you for sunshine, thank you for rain, thank you for joy, thank you for pain. It's a beautiful day, beautiful day, beautiful day. Don't fuss and fight, let us unite. We got one life, oh, it's a beautiful day, yeah, it's a beautiful day. So yeah, though I walk through the valleys of the shadows of death, I will fear no evil, won't be dismayed when I see the clock ticking away and things are not in place. Everything in life happens for a reason. Disappointment comes with a lesson. It's for me to get.
I'm going to have a wonderful time. You know, all the persons who woke themselves up this morning make all the persons who woke themselves up this morning make some noise. Good. All the persons who God woke up this morning make some noise. Stand, please stand for the national anthem. The playing of the national anthem. You may be seated. Thank you very much. Did you know that our national anthem is a prayer? So we start prayer already, But we're going to invite for the official opening prayer Mrs. Tiffany Smith Faulkner, who will come and open in prayer.
Good morning. Hallelujah. 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 Good morning, everybody. Good morning, everybody. All right, so I trust that everyone is doing okay this morning, ain't it? Everybody doing well this morning? All right, for the fact that we're on this spot of ground, we have to give God thanks, right? Let me hear an amen for that. For the fact that we're on this spot of ground, we have to give the Lord thanks, right? Hallelujah. Hallelujah. Come on, man. Hallelujah. All right, so before we go into our devotional activity, let me properly introduce myself. I am Tiffany Smith-Partner from the St. Jacob Park Health Center, and I will be doing the devotion for this morning. All right? Can we all stand for a change? Hallelujah. This is the day, this is the day that the Lord has made, that the Lord has made. We will rejoice and be glad in it, and be glad in it. This is the day that the Lord has made. I will rejoice and be glad in it. Oh, this is the day. This is the day that the Lord has made. One more time. This is the day. This is the day that the Lord has made, that the Lord has made. I will rejoice and be glad in it, and be glad in it. This is the day that the Lord has made. I will rejoice and be glad in it. Oh, this is the day. This is the day that the Lord has made. Oh, this is the day. This is the day that the Lord has made. All right, we're going to sing a prayer refrain before we get into the prayer for this morning. Thanks, thanks, I give you thanks for all you have done. I am so blessed. My soul is at rest. Oh Lord, I give you thanks. Oh, thanks, thanks. I give you thanks for all you have done. I am so blessed. My soul is at rest. Oh Lord, I give you thanks. I am so blessed. My soul is at rest. Oh Lord, I give you thanks. Let us bow our heads in prayer. Heavenly Father, we thank you for this moment and for bringing us together. We ask that you guide us, bless us, and fill us this and fill this atmosphere with your peace, love, and joy. Let everything today be pleasing in your sight, and may each heart be uplifted and be encouraged. In your holy name I pray. Amen. Thank you.
Thank you. Thank you, Mrs. Smith Faulkner. The place is blessed. She brought even worship with us this morning. I want to just add a quick prayer, if you may. Father God, in the name of Jesus, the Christ of Nazareth, I pray that you, Lord God, will control the heat in this place, mighty God. Father God, I pray that even this jacket I am wearing is hot, Lord God, but I know that you can do all things. If you said, come to you, and I'm coming to you, Lord. He said, lay every burden, and I'm laying this burden, and I give you thanks for what you're about to do in Jesus' name. Amen? Amen? Can I see you in the fun, you know? You know you can ask God for anything. Yes, man, and God will do it. All right, wonderful. Now, let me just thank Mrs. Faulkner again for that opening prayer, blessing the place and making sure that we are all welcome, inviting us into God's guidance. I don't know if you're fanning only because of the heat or if your World Cup team did not win yesterday. Because I know a number of persons are watching World Cup. In fact, everybody talking about goals and who's scoring the most goals. But there's one goal today, and that is the goal for a healthier Jamaica. Amen? A healthier Jamaica. Now, to bring the official welcome on behalf of Mr. Orrit Clark, the program manager of the Health System Strengthening Program, please help me welcome Mrs. Steria.
Head of Corporation, Delegation of the European Union in Jamaica, on behalf of Her Excellency Urja Ascola, Ambassador of the European Union, Dr. Nicolette Henry, Senior Health Specialist, Inter-American Bank, Development Bank, on behalf of Ms. Natasha Marzov, that's the IDB Group Country Representative in Jamaica, His Worship the Mayor, Councillor Norman Scott, Mayor of Spanish Town, represented by Dr. Fenley Douglas, JP and Councillor for the Waterford Division, Miss Denise Daly, MP Member of Parliament for St. Catherine Eastern, represented by Miss Keisha Lewis, JP and Councillor for the Lauriston Division, Councillor Theresa Turner Flynn, JP Councillor Hampton Green Division and Minority Leader, Miss Fabia Lam, Regional Director, Northeast Regional Health Authority, Dr. Yassine Hanna, Regional NCD Coordinator for the Southern Regional Health Authority on behalf of Mr. Michael Bent, the Regional Director for the region, Mr. Abdon Campbell, our Parish Manager for St. Catherine Health Department, on behalf of Mr. Lascelles Brown, Regional Director, Southeast Regional Health Authority. We have Dr. Heather Reed, Dr. Simone Spence, who is the Director for Health Promotion and Protection in the Ministry of Health and Wellness, Dr. Tamu Davis, the Director for Non-Communicable Diseases and Injuries Prevention in the Ministry, Dr. Tamika Henry, Medical Officer of Health for St. Anne, Dr. Francia Prosper Chen, Medical Officer for St. Catherine, Dr. Alafia Samuels, our own non-communicable diseases lead in the HSSP, Dr. Camelia Bryan, Program Development Officer for Chronic Diseases and Injuries Prevention, Miss Shireen Walker, Director, Governance Social Development Commission, Mrs. Sana Lee Archibald, Parish Manager for Greater St. Catherine Social Development Commission. We welcome Mrs. Tiffany Smith Faulkner, our Community Health Aide, team of the Slash Roots Foundation, developers of the Jamaica Moves app and public health media, who developed the Chronic Care Connect campaign, representatives of the regional health authorities who are all here today, my colleagues of the Health Systems Strengthening Program from the Project Execution Unit, members of the media, members of the public, and residents of Spanish Town and St. Catherine, all other special invited guests, good morning. On behalf of Mr. Orrit Clark, our Program Manager of the Health System Strengthening Chronic Care Connect pilot and the Jamaica Moves app. This is a proud day for the HSSP. What we launched this morning has been many years in the making. It is a result of careful planning, the building of policy, and the restructuring of our program so that we could deliver this work well. We are pleased to finally bring it to you. You may notice the word connect sits at the heart of what we are launching today, and that is no accident. Today is about connection. It is about connecting how our patients receive care so that the different parts of their health journey work together rather than apart. It is about connecting the teams who deliver care across the ministry, across the regions, and our partners. And it is about connecting people to the tools and the information that help them look after themselves better. That is why today is designed the way it is. The presentations, the conversations, the activities on the outside, the very way this space brings us together are all meant to reflect one simple idea, that good health happens when care is connected. A little later in the program, you will hear more details on each of these initiatives. And in his keynote, the minister will help us connect the dots and show how all of this fits into our wider vision for public health. Ladies and gentlemen, major initiatives, as these are never the effort of one team. So allow me to highlight a few of the partners who connected to help us arrive at this point. To the team at the Ministry of Health and Wellness, led by Minister Tufton and the Permanent Secretary, we want to thank you for your continued oversight and vision. We are very grateful to the CMO, Dr. Jacqueline Bisaser McKenzie, and her office for their guidance with the Chronic Care Connect implementation. And to Dr. Sadler, Dr. Davidson, and her unit for their dedication in bringing these initiatives forward. I also acknowledge our project steering committee, chaired by Mr. Howard Lynch, and the many stakeholders at every level who keep this work moving. To the Slash Roos Foundation and the public health media, our main contractors for each of these initiatives, and our regional health authorities, we thank you for your steady partnership. Your teams on the ground are what make this work real for patients and communities. And to everyone here this morning, our partners, our health teams, members of the media, and members of the public, thank you for joining us. We welcome you. We have a full program ahead, so please enjoy the proceedings.
Thank you, thank you, thank you, thank you very much, Mrs. Frith, for that warm welcome. Of course, you know we are launching two very important practical tools. That's the Chronic Care Connect and, of course, the Jamaica Moves app. How many practical tools are we launching? Nobody, the microphone now work at all. Hold on, let me come and say. How many practical tools are we launching? Two. How many persons in the comedy door? What? Listen, let me just say this early. Everywhere I go, they ask me one question because I am the only person who walk around with two persons' name everywhere I go, and they ask me where is the other every time. And I heard it mentioned by Mrs. Frith a while ago. So let me officially introduce myself. My name is Ian Ity Ellis, ITY. It's an acronym. ITY means I thank you. Don't ask me. I just tell you from early, right? Because I am going to be your soul. I don't know why it is that everywhere I go. In fact, my daughter, she was at school and somebody pointed her out and said, you know who for daughter that? And I said, who? I don't know how that happened. If my wife was shopping in the supermarket and somebody saw her and said, do you know whose wife is that? I don't know how it happened. You know, I am my name is Ity. I was vacationing, celebrating my wedding anniversary, and the housekeeper knocked the resort door and saw me and said, "It, where is I said, "He's inside there. I don't know." But we're launching, I am the only one here, but we're launching two practical tools today, all right? The Chronic Care Connect app, and Chronic Care Connect and the Jamaica Moves. We're going to be moving forward, and we're going to be inviting now to bring greetings. This is Dr. Yassine. Microphone, you're going to work today. Dr. Yassine Hannah, Regional NCD Coordinator, and she's coming on behalf of Regional Director Michael Bent, SRHA. Sir, please make her welcome as she comes.
Good morning, everyone. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, distinguished partners and dignitaries, members of our health teams across the ministry and the regions, members of the media, members of the community here, and all other protocols observed. It is an absolute honor to stand before you today and bring greetings on behalf of my regional director, Mr. Michael Bent, who is unavoidably absent, on what marks a true milestone in our collective journey toward a healthier Jamaica. Today, are you hearing me? Not so well? Can I take this mic out, or it's not a... This one is for the camera. All right, can I try with a... Okay, this is better. All right. I won't go from the top. I will just say it is an honor to be here representing our region. Today we're not just launching Chronic Care Connect and the Jamaica Moves app, but we are deploying a powerful modern weapon in our ongoing battle against non-communicable diseases. We are painfully aware that our nation is facing a silent crisis. Non-communicable diseases are no longer distant threats. They're in our homes, affecting our parents, our siblings, our co-workers, and even the statistics show us that the burden of NCDs in Jamaica is immense and growing. Even more troubling is the staggering prevalence of the risk factor of these conditions. Too many of our people are living with undiagnosed high blood pressure, elevated blood sugar levels, and high cholesterol. Physical inactivity, unhealthy dietary habits, and harmful substance use have become normalized in our daily routines. These aren't just cold numbers on a page. They represent lost productivity, strained family structures, and far too many premature graves. But as the saying goes, knowledge without action is a problem. While our healthcare teams work tirelessly, the truth is that the healthcare system cannot fight this battle alone. True victory over NCDs requires a fundamental shift in our culture. It requires each and every Jamaican to step forward and take personal responsibility for their health. Our health is our most valuable asset, and this is exactly where Chronic Care Connect and the Jamaica Moves app changes the game. These tools bridge the gap between clinic and daily life through the power of self-monitoring. Self-monitoring enables early detection, improved medication adherence, and data-driven conversations between patients and healthcare providers. As a regional health authority, our presence here today is a testament to our unwavering commitment to the fight against NCDs. We are dedicated to re-engineering how we deliver care, ensuring that public health interventions are accessible, equitable, and innovative. We anticipate that these programs will bring immense benefits to our population. Together, by combining state-of-the-art innovation with personal accountability, we can change the trajectory of public health in Jamaica. Thank you.
Thank you very much, Doctor. And of course, we couldn't be gathered here in Spanish Town. Hablo español? God is good? All the time? Dios es bueno? Dios es bueno? All right, we're going to work on it. We're going to work on it. We're going to work on it. All right. We want to invite to bring greetings on behalf of the South East Regional Health Authority, and this is Mr. Abdon Campbell, Parish Manager for the St. Catherine Health Department. Please make him welcome, please.
Thank you, Mr. IT. I know you're alone, so won't take it beyond that. Let me welcome you to St. Catherine. This is my parish. It's a bit hot, but if we ask for the sunshine, some other things will come with it. I will stand on the protocols already mentioned. So this morning, it is a privilege to join you and have you join us as we highlight one of the most transformative initiatives shaping the future of healthcare in Jamaica. Chronic Care Connect. Now, the future of healthcare is not defined by how many illnesses we treat. It is defined by how many illnesses we prevent, how many lives we improve, and how effective we empower people to live healthier, longer, and more productive lives. Today, I encourage every Jamaican to take advantage of the opportunities being created through this initiative. Download the Jamaica Move app. Participate in health screening. Visit your healthcare centers regularly. Engage with your healthcare provider and make your health a priority. Together, we can reduce the burden of chronic disease, strengthen our healthcare system, and build healthier communities across Jamaica. So on behalf of the Regional Director of Southeast Regional Health Authority, I am proud of the partnership, innovation, and dedication that have made this initiative possible. I commend the Ministry of Health and Wellness, the Health System Strengthening Program team, the European Union, our healthcare workers, and all stakeholders whose commitment continues to drive meaningful change within our healthcare system. Let us seize this opportunity to transform not only healthcare, not only how healthcare is delivered, but how healthcare is valued and protected throughout the nation. Let me say thank you, and may we continue working together to create a healthier Jamaica for generations to come. And for my fellow healthcare workers, as we connect today, let me stretch you a little more. Let me ask that we all connect to compassionate care, the way how we deliver health care. Let us all put our focus there and connect to first world health care. So again, thank you. Enjoy the rest of the day. And tell your friends, tell your neighbor about Connect Care.
Thank you very much. There's someone clapping right now, and I want to invite you to go and visit your car, Mercedes-Benz 9012LY, 9012LY. And if you don't go right now, you won't be clapping anytime soon because you're on the field and it's near a truck, and trust me, you want to keep it intact. The breeze. It is so good for us to help each other today because it's all about a healthier Jamaica. It's our goal today. And we are moving through the elements. All right? All right, now we want to invite to bring us greetings. It's JP and Council of the Waterford Division. That's Dr. Fenley Douglas, representing His Worship, the Mayor. Please put your hands together and welcome him, please. Yes, man. And look at the person beside you and say, neighbor, if you weren't here today, I'd be the best looking person. Yeah, man, cheer them up, man. Make them smile, man. Come on, the place hot enough, man. Say, oh, cheer up, man. All right? Thank you very much.
Thank you, moderator, IT. Just ask the truckman kindly fast. But it gives me great pleasure this morning to bring greetings on behalf of the parish and to say that I am happy that this launch took place here this morning in the parish of St. Catherine. The launch, two-tier launch, Chronic Care Connect and Jamaica Moves. We're at a stage, ladies and gentlemen, where Jamaica has changed a lot, where we're eating ourselves to death. It might sound strange, but it is true. And just take a walk with me for a minute. In the new Jamaica we're living in, nobody moves. When we were children, your mother and father would scold you because you played too much, you rammed too much, go back inside the house. Now we're saying go outside and play and put the tablet down, go find something and go play, man. The world has changed. We have become a nation that eats on time and not to eat when we're hungry, but we eat when we're told to eat on time. A child is crying, a baby. The first thing the mother does is to put that breast in the mouth because it must be hungry. You're hungry. You're going to school in the morning, to infant school. You eat something before you go to school at 7:38. It doesn't mean you're hungry at 10, but at 10 it is break time to go and eat something again. And while you eat something, it is that biscuit and sweet juice you consume at 10, and 12 o'clock, lunchtime, 2 hours after, it doesn't mean you're hungry, but the time says, let's go and eat again at midday. School ends at 2:30, and your caregiver comes for you, and she gives you a snack, which is what? A biscuit again and juice because dinner is not ready. And we continue this trend throughout school, then into our work lives, where the bosses tell you when is your lunchtime, so you eat on time, but you don't eat because you're hungry. The result of that, a recent statistics from the Ministry of Health states that 7 out of 10 Jamaicans that die from a non-communicable disease. That means out of every 100 person that die, 70 of them die near expiry date, that is, sweets to give our children. Whoever look at a sweetie pack and see when it expires? None of us. But we're giving our children those sweets to eat. It means that we now have to carve laws to hurt some people. It means that you have to be cruel in order to be kind, to save lives. And it means that some of our friends, as a politician, I can tell you this, will be falling out of grace with them, but we will be saving the lives of Jamaicans. Ladies and gentlemen, again, I must state that I welcome the launch of the Jamaica Moves mobile app, and it starts from home. The Ministry of Health alone can't do it. It starts from home, from birth. So let us all play our part to make sure that the new building we are going on with across here the hospital, that one day it can become a hotel and not a hospital to send our people to. God bless. One love.
Hotel and not a hospital. Somebody say, eh? What an aspiration. My God, my God, my God. Our goal is a healthier Jamaica. I know we cannot do this without support, right? Like in football, you need support. You know, we're talking about football every day now, so whatever we do. So in transforming Jamaica's health system, it requires leadership, government leadership. It requires committed healthcare professionals. And of course, the Health System Strengthening Program is administered with the support of the Inter-American Development Bank. So to bring greetings on behalf of the IDB, please help me welcome Dr. Nicolette Henry, Senior Health Specialist. Here she comes wearing khaki, the blouse and the jacket match, and she walks daintily because she's a queen. Put your hands and make her welcome. She is a queen and she's Jamaican and she's here with and on behalf of IDB. Here she comes. Let me just... Wonderful.
Thank you so much. So I begin my remarks this morning by first recognizing Dr. the Honorable Christopher Tufton, Minister. Thank you so much for that. So I begin my remarks this morning by recognizing Dr. the Honorable Christopher Tufton, Minister of Health and Wellness of Jamaica, distinguished representatives of the Ministry of Health and Wellness, development partners, members of the healthcare community, members of the media, invited guests, ladies and gentlemen. Kindly allow me to adopt the protocol already established. It is my pleasure to join you today for the official launch of the Chronic Care Connect media campaign and the newly enhanced Jamaica Moves mobile application. On behalf of the Inter-American Development Bank, I extend congratulations to the Ministry of Health and Wellness and all partners whose vision, dedication, and collaboration have brought us to this important milestone. Today's launch represents much more than the introduction of a media campaign and a digital platform. It reflects access to quality healthcare services, but also access to information, support, and tools that empower people to take an active role in managing their health and their well-being. That is why today's initiative is so important. Additionally, the Chronic Care Connect campaign is designed to provide trusted, accessible, and practical information that helps individuals better understand chronic diseases and make informed decisions about their health by increasing awareness of treatment adherence, healthy lifestyles, physical activity, nutrition, and disease management. The campaign can support positive behavior change and encourage greater engagement between patients, families, and healthcare providers. At the same time, the enhanced Jamaica Moves mobile application demonstrates how digital innovation can contribute to better health outcomes. Technology has the power to bring health information directly into people's hands, making it easier to track progress, stay motivated, access educational resources, and adopt healthier habits. When designed with users in mind, digital tools can help bridge gaps in access and create new opportunities for prevention and self-management. These initiatives also underscore an important principle. Improving outcomes is a shared responsibility. Governments, healthcare professionals, multilateral development partners like the IDB, community organizations, the private sector, the media, and citizens all have a role to play. Sustainable change happens when people are equipped with the knowledge, resources, and support they need to make healthier choices every day. The IDB is proud to be a long-term committed partner, supporting efforts in strengthening health systems, promoting innovation, and improving the lives of people across the region. We recognize that investment in health, our investment in human capital, economic resilience, and sustainable development. Healthy populations are better positioned to learn, work, and contribute to their communities, and also to participate fully in national development. We are encouraged by Jamaica's continued partnership in advancing public health initiatives and embracing innovative approaches to disease prevention and management. The launch of Chronic Care Connect and the enhanced Jamaica Moves application reflects a forward-looking vision that places people at the center of healthcare and empowers them to become active partners in their own well-being. As we celebrate this achievement, we also must recognize that this is only the beginning. The true success of these initiatives will be measured by their impact on people's lives, by the individuals who gain a better understanding of how to manage their diabetes, by the patient who remains committed to treatment, by the family that adopts healthier habits together, and by the communities that become stronger and healthier as a result. I therefore encourage all stakeholders represented here today to continue championing these efforts, expanding their reach, and ensuring that the benefits are felt across Jamaica. In closing, I would like to once again congratulate the Ministry of Health and Wellness and all partners involved in bringing these initiatives to fruition. The IDB remains a committed partner to support Jamaica's efforts to improving health outcomes and building a healthier, more resilient future for all. Thank you, and I wish both the campaign and the Enhanced Jamaica Moves application every success. Many thanks.
Thank you, Dr. Henry, for confirming or reconfirming IDB's support of this very, very important Excellency Ambassador Erha Ascala. Please welcome Mr. Anicito Rodriguez Ruiz, Head of Cooperation at the European Union Delegation in Jamaica. Please make him welcome as he comes.
Thank you very much, Mr. Master of Ceremonies. A protocol has been established. I would like to acknowledge the presence of the Honorable Minister, Dr. Christopher Tufton, Minister of Health and Wellness, but also greeting other distinguished leaders, managers, employees within the Ministry of Health and Wellness, but also other ministries, departments, and agencies of the government. Also, greetings to my colleagues from the Inter-American Development Bank. Also, members of Parliament, leadership of the municipalities of Spanish Town, other neighbor communities, business interests, residents, media. Good morning, almost good afternoon. Good morning, everybody. we are in St. Catherine. This parish represents one of the most populous geographic spaces in Jamaica. I think it's the second one in population after St. Andrew. And I just had some figures that St. Catherine is more populated than 9 of the sovereign independent Caribbean countries. Then you can perfectly understand why we are here today and why it's here in St. Catherine that we are launching these 2 applications today. I would like to talk to you about something that touches the life of every individual, regardless social, cultural, or even political differences. This is healthcare. At the European Union, we are 27 member states, different cultures, different languages, different histories. We even were killing each other until just 70 years ago. But there is something that unites us, is a belief that every person deserves access to high quality healthcare. Because we believe that healthcare is not just a service, is a fundamental value, is a human right, is a necessary pillar for social and economic development. I can say that the European Union and Jamaica share the mutual belief that a healthy population is the foundation of a stable, strong, and prosperous society. It's mutual belief such as this that stands at the heart of our partnership that spans now for more than 50 years between the European Union and the government of Jamaica. We just recall the demand for solidarity at the COVID time. It looks like very, very far away, but just 4 years ago, where this pandemic taught us something, that healthcare, public health responses, and investments in infrastructures and research requires global cooperation, because the virus, they don't know about borders, and at that time the EU responded with a deepened partnership with CARICOM, with PAHO, through the program COVAX, extending health support to countries like Jamaica. Now, with this health program, along with the Inter-American Development Bank, the European Union has committed 1.8 billion Jamaican dollars to multiply initiatives. Jamaicans are intended to benefit from a new and renovated hospitals and health centers, from more efficient health services, and from the training programs extended to diverse categories of staff. However, this health system strengthening program, like previous other supports from the European Union to the health sector, is not just about providing facilities, about providing infrastructure, about providing training. It is mostly about people. It is about giving healthcare workers the tools to do their jobs, and the tools and resources to save lives. Especially when we consider the global statistics on the rise of deaths caused by non-communicable diseases. This financial support from the European Union is intended to support initiatives that encourage lifestyle changes among the Jamaican population that can actually save lives. And so we are pleased to be associated with this patient-centered initiative that is designed to empower Jamaicans to play an active part in managing their health through access to information and to support for the management of diabetes and hypertension. Indeed, various technologies now rule our lives. Then, time to take benefit and use these technologies for saving lives. So today, we are not just cutting ribbons or talking about new equipment or new buildings. Today, we are making progress together towards a more inclusive and accessible, a healthier, a stronger future. A future where the lifestyle choices that each individual makes will save his own life or that of his or her family members. In this future, we recognize and reiterate that good health care must prioritize our investments in people. We must continue to promote healthy lifestyles, fight diseases before they spread, and ensure that the emerging mental health challenges are part of our collective focus in planning, in policies, and in actions. Even or especially using these mobile applications and other forms of emerging new technologies. The EU remains committed not only to improving healthcare within its own borders, but through ongoing cooperation with countries like Jamaica and through partnerships with agencies such as IDB, to build healthier societies, not only to prevent illnesses, but as a foundation for human well-being and by extension to contribute to robust economies that meet their development goals. Let us continue building this partnership between Jamaica and the European Union and together while creating a future where health is a reality for all. Thank you very much.
Muchas gracias. Which team? Cup. Which team are you supporting for World Cup?
Well, I'm supporting.
Careful.
Yeah, I'm supporting two countries, mainly Spain, of course, it's my own country, but also Haiti, with Caribbean solidarity. They are eliminated, but let's go for Haiti.
I love that. Haiti, him say no. You hear him say Haiti? I never pick up, I never pay attention, you know. I want to say he's supporting Haiti. What's my name? Thank you very much. I love it. Who are you supporting? You know, Jamaicans, we are not born in the place, and we will tell you, say, our team played yesterday. You know what I mean? Some persons here say on cars, Brazilian flags and all these things. Anyway, I want to thank you for your greetings and presentation. We're going to take a break from the monotony of the speeches and the greetings, and we're going to have a little break with some entertainment. Are you ready? We have an excellent entertainer who's coming. He's very trained. By the way, anybody here did receive your results from the PEP examinations? Nobody did PEP? Nobody here sat PEP? Oh, okay. See a student over there. Thank you very much. Yeah, you did well? Congratulations. We have one person who sat PEP around the body. Give me a round of applause. The results came out and we're ready. Anybody did GSAT? GSAT? Nobody did GSAT to enter high school? I'm just checking. Nobody did GSAT? I want to know if my people them there, and I'm just checking if my people are here. So PEP gone. Anybody do GSAT? GSAT. Oh, you have some GSAT here, man. 1, 2, 3, GSAT. No, I want to check my real people now. My real people. The real people who don't wait on an email to know if you pass. Because your name came in the newspapers. Somebody stand up where you are and celebrate yourself, man. We've been sitting all morning, man. Tell them to make some noise, man. We did common entrance. We did maths, English, and we did not use any chat GPT. In fact, all we needed was a pencil. A particular pencil. Not any pencil. What kind of pencil we use? H2. Oh, clap on yourself now. We're special. So we're celebrating ourselves this morning. Please help me to welcome this saxophonist. His name is Raheen Fletcher. Make some noise for Raheen Fletcher as he comes to entertain and play for us this morning. Thank you very much. Ryan, come here, Ryan. Thank you very much. We're getting to that very important part of the function, though. You know, Ryan, can you sing?
No, I can't.
Sing. Very good. Give me a round of applause again. You know what I mean? Me can't sing neither. So I just realize if you can't sing, learn to play. And anybody here can sing? If you cannot sing, give him another round of applause, please. Wonderful, wonderful, wonderful. You think it easy. No, that was very refreshing. Now we turn our attention to the very first of today's major initiatives, and that's Chronic Care Connect. The name itself communicates purpose. It's about connecting patients to care, connecting healthcare providers to useful information, and connecting healthy advice to sustained action. Chronic Care Connect represents a more proactive and patient-centered approach to managing chronic illness. So instead of somebody waiting until a person's condition becomes a medical emergency, the intention is to provide continuing support that can help patients manage their conditions more effectively. So, to provide an overview of the Chronic Care Connect pilot, please welcome Dr. T. Alafia Samuels, non-communicable diseases lead with the Health System Strengthening Program. Please make yourself welcome. Make her welcome as she comes. Dr. Samuel. Get this.
Thank you very much. Good morning. I think it still is afternoon, everyone. Mr. Minister, Dr. Henry, and Mr. Ruiz, colleagues and friends, good morning. Thank you. So the next slide will tell you that component 2 of the HSSC project is intended to improve the quality and efficiency of health services, and the chronic care model has been chosen as the mechanism. We have the chronic care model in 6 pilot health centers, 3 in St. Anne, 2 in St. Catherine, and 1 in Clarendon. And we have used cholesterol, giving them heart attack and stroke. So the control of hypertension in patients with diabetes is critical. In diabetes, we have 1 in 9 adults, and 85% of them are not controlled. The next slide will tell us that CCM in the HSSP was introduced from back in 2022, and Maypen Health Center has been running their CCM for 3 years. Dr. Jabel Campbell, could you stand and let us acknowledge your leadership role in introducing the CCM in Maypen? I would also like to recognize Dr. Rohelia Wallace from St. Anne's Bay, who has been running her CCM for 2 years. Their experiences, Their experiences have informed the CCM Standard Operating Procedures document, which has just been approved by the group in March, and it is forming part of the basis for this launch, which is a reboot of the CCM using the concept of Chronic Care Connect. We propose to graduate the cohorts from Maypen and St. Anne's Bay as soon as the evaluation is done, and then we can enroll new cohorts. This next slide shows you a picture of the exercise club in St. Anne. Dr. Wallace and her husband have been very active in that regard. And then some of the other CCM interventions in the other pilots in the next slide will show that we have had educational sessions, nutrition team assessments, social worker referrals, exercise clubs, patient support groups. Patients see the same doctor at every visit. Usually, when you go to the health center, you see whichever doctor. But the CCM patients all talk about the fact that they have their own doctor, and they develop this relationship with their doctors. I think that's an important thing as well. Other kinds of screening, discussions, and communication. The next slide will just talk about Chronic Care Model and Chronic Care Connect. Today we are launching the public-facing campaign of the Chronic Care Model, which is Chronic Care Connect. It is chosen as a new slogan because we want to connect using the electronic health record. We want to connect using the community health aides and giving them the tools, seeking phone access for the CHAs to make their connections. And we have CHA toolkits and tablets and foot care tools. Next slide will show some of the documents that have been developed for the Chronic Care Connect. The one on the left is the standard operating procedure. This was approved and reviewed in the March workshop. And then on the other side, you have a practical guide for healthcare workers developed by Public Health Media. Another important activity was the Chronic Care Capacity Building Workshop, handing over the CHA toolkit to the St. Anne Parish Manager, Mrs. Hyde. So the patient self-management supports are the two areas that you're going to, on the next slide, the two areas that we're going to hear about in the next two presentations. And finally, the final slide just indicates some of the outcome indicators that we are hoping to track using the electronic health record. I'm also happy to advise that there is a member of staff coming on to assist us with extracting reports out of the electronic health record for CCM, but of course it's the one EHR, so we will be able to do it for most persons there. So the key things are, is the diabetes control to target, is the blood sugar control to target, because that's the final common pathway towards premature mortality, which is what we're trying to reduce. So the final slide, I just want to remind you that you can either pay the farmer now or you can pay the pharmaceutical companies later on. Thank you very much.
Thank you very much. Can I have a photograph with you? I need to come take the picture for me, please. Later take a photograph of you? Yeah. Yes, thank you very much. And I want to take a photograph with that doctor there. Anyway, please put your hands together again for her. All right, wonderful. Now cast your eyes on the screen where we'll introduce you to some testimonials from the chronic care experiences shared with you. Here we go.
The Chronic Care Model is an initiative of the Health System Strengthening Program, and today we launched Chronic Care Connect, which is the public-facing version, which includes information that we want to collect on things like medication adherence and follow-up visits at home and so forth. The whole idea behind Chronic Care Connect is to improve patient outcomes by connecting the dots, making better relationships and better connections between the health workers, the patients, and the community.
When I came, I was suffering from a pain in my hip. I went to do some x-rays. They said I was having bone degeneration or something like that. But I tried and I tried to persist. As Ms. Porter said, sometimes you feel like you don't want to come. So you have to put the extra energy in and say, okay, you must go, you must go. Even when it rains, sometimes I say, I'm not going because it's raining. But when I realized I started feeling better in my hip, I said, okay, let me continue. And then more so now when we formed the organization, put it in proper perspective, they appointed me as the assistant secretary. So of course I have to keep up now. So I will be absent if I'm on, a break overseas or so. But I come every Monday, every Wednesday. Sometimes I get there late, of course. But I still come and I do my exercise. But the camaraderie that we have, bond that we have, the whole fellowship of, getting together, because in the mornings they start with devotion and that sort of thing. So it keeps us together. It keeps us, being interested in each other. And as she said about the group, for birthdays, wishes go out in the group. If somebody has a death, it's out in the group. So you'll be in touch with what is happening. So we are enjoying it. We go on the trips, as she said, we have the cookouts, that sort of thing. And I think we have grown. We have really grown because, of course, I'm at the register, so I see where the numbers are, yes. So we are nearing 100 persons. Some don't come regularly, but we have them. But it was a great idea. I think it. I don't have any stress. It helped me because I didn't have to go to a counselor over the other side here. I don't have that anymore. I have carpal tunnel syndrome in my hand. And it not even coming like say me two hand them sick. After when me kick up, man, and me kick up and me kick up and
That behind every statistic is a person. Behind every blood pressure, there's somebody's mother, father, sister, brother, colleague. So 100 volunteer patients across 6 sites who are living with diabetes and hypertension. Patients across 6 sites who are living with diabetes and hypertension.
Good afternoon, everyone. All protocols observed. It is my pleasure to introduce the new mass media campaign entitled Take Charge of Your Health and the materials developed to support the Ministry of Health and Wellness launch of our new program, Chronic Care Connect. These materials, which include videos, posters, billboards, brochures, flyers, and social media card share, has been carefully designed to educate Jamaicans across all age groups about the Chronic Care Connect program and the prevention and management of 2 of our most common deadly chronic diseases, diabetes and hypertension. The mass media campaign is part of a greater social media and behavior change communication strategy that aims to contribute to a reduction in the uncontrolled diabetes and hypertension in Jamaica by increasing knowledge and awareness, increasing patient confidence in the management of their conditions, and also motivating healthcare professions to provide patient-centered care. The strategy employs multiple social and behavior change principles and approaches differentiated for the various stakeholder groups and their specific needs. It also facilitates advocacy, behavior change, communication, and community mobilization, strengthening patients' confidence in managing the enabling environment for increased knowledge, awareness, and ownership. The campaign message mainly targets people living with condition, diabetes and hypertension. However, some materials were developed specifically for family members, community members, and healthcare workers to ensure that people who surround our patients every day are well equipped to provide additional support to manage their health effectively. What makes these materials meaningful is that they were developed through a collaborative process, including formative research and message concept testing with patients and healthcare professions at 2 of our pilot sites, which you guys would have heard that they were the Mapen Health Center and the Brownstown Health Center. The experience and insights of these patients and healthcare professionals have helped to ensure that the message that are practical, relatable, and memorable and responsive to their needs of the Jamaican public. Together, these campaign materials will raise awareness for proper diabetes and hypertension management, as well as to empower individuals to take charge of your health through simple steps towards achieving their greater health goals. We are proud to present these materials, and we look forward to the positive impact that they will have in helping Jamaicans in living longer and healthier lives. Thank you.
Thank you very much, Dr. Camelia Brand. All right. And now, to introduce the Jamaica Moves app. Of course, you know, communication is very vital because people rarely change their lives merely because they receive more information. But it's very important that they get this in their hands. You know, everybody have a phone. Anybody here have a phone? If you have a phone, it's a phone. Wonderful. So please help us to introduce this campaign. Now, an overview of the campaign. Dr. Tamu Davidson, Director of NCD, Director of Non-Communicable Diseases and Injuries Prevention at the Ministry of Health and Wellness. Please bid Doctor welcome.
slide. So we know that we have over 600,000 persons living with hypertension and over 200,000 with diabetes. So that means we have a huge, huge customer base, client base, that can really benefit from this app. So the app targets adults of all ages living with NCDs. Next slide. Next slide. So how does it help? So it helps those persons with NCDs monitor their own numbers. And if you do not have an NCD, again, it will also help to track those risk factors for NCDs. So it also helps persons learn more about their non-communicable disease. Next. So if you have the app, it is personalized, and of course, it tells you hello. So imagine yourself with this app at home. The app will also track your physical activity. The app will also track your blood pressure, your blood glucose, your weight, and BMI. So these are essential numbers that we need to know in order to manage your illness. You will also learn about your readings. So for example, with the blood pressure, you will see whether you are controlled or uncontrolled. And so it will tell you whether you're meeting your target. So you can track your number and your progress and really check in and get your report card. Next. This gives you for a month. So as you can see, what's happening with this person for the month? Green means they're doing really well, and yellow means that they're not doing so well. So for the month, what would you say to this person? There's more work to be done. And so that could be you tracking your health. Then there's some quick tips, so you can also not only track your health, but get information more around different tips in how to become more physically active, nutrition tips, tips around knowing what diabetes is, your high blood pressure, how to manage it better. And so the app gives you this power in your hands. You can, as you can see, these are just some of the things and features that you will see in the app. Next. So I'm going to charge every single one of you. I should see all phones up, scanning, downloading, and of course we have accommodated for anyone who may have an iPhone for the App Store and for the Google Play Store. Thank you. I'm looking forward to seeing those numbers going up and for you taking your power of your health into your hands. Thank you.
Thank you, Dr. Davidson. Please cast your eyes on the screen now for the video representing the Jamaica Moves app. Make sure you download the app, get familiar with it, get used to it, so you can use it, but cast your eyes now on the screen.
My health are my responsibility. So I use Jamaica Moves app to keep track of my pressure and sugar levels. I can even keep track of my exercise and my weight so I can know if me I put on too much. With this app, I can have all health information handy for any clinic or doctor I go to. The app all send me tips on how to take care of my health and about healthy foods I should be eating. And trust me, if I can use it, so can you. Download the Jamaica Moves app from the App Store or Google Play Store today. Take charge of your health.
A message from the Ministry of Health and Wellness.
Dr. the Honorable Christopher Tufton. Dr. the Honorable Christopher Tufton. Please make some noise and welcome him. When a big artist come on stage and make night and survey, make some noise for the Minister now, Dr. Tufton.
Thank you very much. I normally don't see you at these functions, Mr. Chairman. And so I never really expected you, but I'm happy you brought some laughter to the audience here. Distinguished ladies and gentlemen, we are off to a late start, and the sun is warm in the true spirit of Spanish Town sun. And I fully appreciate and understand that. And so, with all the challenges we have had, including the technical difficulties, and my coming a little late too, so I'll take some of the burden. Let's move on with it because I think you have seen a lot. I want to just recognize, though, representing the mayor of another city, and we soon sort you out, your hospital coming, don't worry yourself, right? Good to see you, sir. I want to recognize the members of the IDB. Good to see you. And your team, members of the EU. I think you're alone here. Do you have a support cast with you? Oh, right, of course, you have a support cast. Members of the Ministry of Health and Wellness who are in your numbers, won't call any names, and of course the health system strengthening team that are here. I want to just recognize you. So we're launching, as part of the way forward, 2 additional programs under the health system strengthening program. The Chronic Care Connect, which you would have heard an explanation by Professor Alafia Samuels earlier, and Jamaica Moves mobile app, which, oh, this breeze is coming hard. You probably can turn it off until I finish talking. And I won't be that hot over the next 5 minutes or so. Which Dr. Davison spoke earlier about. Dr. Davison, of course, a part of the NCD unit. We celebrate the partnership, and I want to just place on record our appreciation to the IDB and the EU for the partnership that the Ministry of Health and Wellness and themselves, through a number of agencies, not just health, Ministry of Finance, the Planning Institute, and others. I'm not sure they're here today, but we want to just recognize them. And of course, the members of the health fraternity on the ground who have been critical to the implementation, led by Mr. Orrit Clark and his team. I want to recognize them, and I want to say that the country is better off because of this partnership. Let me just put that on record. And the relationship has been very complementary in terms of the skill sets, in terms of access to the resources, and we have had far more good than challenges. How is that? And we celebrate the progress that we are making. This year is a defining year under this partnership, because this year is when you will see officially, all other things being equal, the opening of 3 very important pieces of infrastructure: Old Harbor, St. Diego, and Portmore. You are seeing programs like the Chronic Care and the Jamaica Moves Up. You would have seen other critical aspects of this program, the health information systems that have been implemented in a number of institutions, so moving away from the paper base, embracing the technology. You would have seen, for those who are directly involved, training of our staff in order for them to become more competent in use of the technology and the new approach. And so the process of health system strengthening under this IDB, EU, and of course, Government of Jamaica program is going according to plan, despite a few delays in the early stages. And we do anticipate, in fact, we have already started seeing benefits of the program. And we do anticipate that this year, 2026, and in next year, we're going to see significant more benefits when Spanish Town Hospital is open, when these health centers are open, and all the services and the quality of service is enhanced and improved. So we celebrate that, and we thank our partners for working with us, and we do look forward to a continuation of this effort. These 2 launch agenda items today are important additions. The data on hypertension and diabetes was said earlier. I don't need to repeat them. 500,000 in one case, I think 600,000 in another, Jamaicans who are impacted by these chronic illnesses, lifestyle-related illnesses. And the attempt at tracking through the chronic care model and getting persons to be involved is very, very important. And so what we have is a pilot of sorts, and the extent to which that pilot is successful, it will be rolled out across the country. And so far, so good, based on the reports that have been launched here, been given here. The Jamaica Moves program, everybody know about Jamaica Moves. One thing we have is name recognition. And everybody think it's a jump up and dance and prance thing, right? But it comes with benefits. It's about promotion of physical activity, nutrition also. And in this instance, it's tracking other aspects on your device. So right in your home, on your body, based on what your phone and maybe other devices. And I'm proud of Jamaica Moves, having started it when I became minister. And I think it will go places, but we're going to have to work to ensure that you connect. So one of the underlying principles of this approach is embracing technology. And it's so important that we recognize that a big part of our task is going to get Jamaicans to embrace the technology. There are many apps out there. I wear the standard by which all sport watches are judged. And I'm not recommending the watch, but this is a Garmin, right? And people who are into sports, they wear Garmin. Some people wear Apple, but Garmin tends to be the more popular one. And you can, in fact, do some tracking. Well, I do a lot of tracking on this. And there are other things, you know, the Whoop and other stuff. But here we have our own indigenous, customized, appropriately designed for our circumstances application that we can download and track. And we will add features that are essentially more relatable to us within our own setting. That's a good thing, right? We are creating our own thing, using our own creativity, using the circumstances that are more relevant to us. And therefore, I commend its use at all times. But we have to now get the change management right to get Jamaicans to log on and to use the app and indeed to subscribe to the programs, the chronic care model, if they are so affected. And that's going to be the big challenge going forward. Now, Jamaica Moves is still on and active, but we are going to see more activities in the months to come. And the intention is every time we meet in the town square for a good workout session, or anywhere else for that matter in the communities, we're going to tell people to download the app. So I do envision that alongside the physical activity will be the encouragement for people to download the app. And that will be a critical part of the program. Hopefully we achieve the objectives that we set for ourselves. I want to say two quick things, or maybe three, in the next 5 to 6 minutes. What we're doing, which I hope is not lost on the country, certainly not lost on you in this room because you're involved with it, is changing the approach to how we support healthcare and support the health of our country, of our people, of our citizens. There are perceptions that have been the major hindrances to the lifestyle chronic illnesses that we face. And we are going to have to accompany the modernization under programs like Health System Strengthening with a mindset change. And we're not there yet. We're not there yet. And that mindset change is as applicable to those who work in health as it is to those we are seeking to provide health services for. In fact, if those who work in health do not adjust that mindset, it's going to be literally impossible to get those where we expect or hope will change their approach for them to log on, in a manner of speaking. And we're not there yet. We're not there yet. We have 24,000 staff members in health the last time census I saw when I spoke in the sectorial. And I believe that every single one of us, myself included as a minister, needs to spend some time to reflect on what it is that we need to do differently in order to get a better result in terms of the health profile of our population. What it is that we need to do differently in order to get better patient compliance. What is it that we need to do differently in order to support those who are either ignorant of what they need to do or indeed are otherwise distracted or convinced by a society that is filled with distractions, whether it's on social media, it's a tradition or custom or otherwise. If as health workers, we continue to do the things that we have been doing 10, 15, 20 years ago, if as health workers we embrace the lifestyle that ultimately causes us these NCDs, the chronic illnesses, we are never going to get the kind of change at the levels and the degrees that we expect to make a fundamental difference. And in a sense, that's where I think one of the biggest challenges lie. And in this dispensation, having invested as a government so much money, millions and millions of dollars, still a work in progress, but the investments are tangible and visible. No one can challenge that. The change has to begin with us. And it is not yet happening as adequately as it ought to. Let me give you some examples of why I think it has to begin with us, but it's a societal issue. This perception that your health is somebody else's responsibility is something that we have to dispel. Because what we're launching here as a chronic care model and a Jamaica Move app, as they say, it takes two to tango. In other words, if we as the internal stakeholders don't promulgate it, are not available to support it, and the community is not going to log on and adjust appropriately with the support of these apps, then clearly we are going to be fighting a losing battle. And the trend of lifestyle diseases will continue. And so when I say it's always someone else's responsibility, the anecdotes of that is that we can live any way we want to live. And when we're sick, the hospital must save us. If we get diabetes and hypertension from salt, sugars and fats or alcohol and tobacco, it's not our fault. It's the hospital must save us, must give us back life. And no matter how much we treat ourselves in that way towards that end, if we don't get the service to save us, then it's the hospital or by extension the government. And that's something we need to change. Because if we don't, it's a problem. The same applies for the issues around how the system responds to people. You know, over the last day, I've been struggling to understand at an institution like the University Hospital of the West Indies, nurses demonstrating about overcrowding in A&E. And I asked the question, is that unusual? Because we do have spikes when periods of overcrowding takes place. And doctors and nurses are accustomed to that. But clearly there's an issue. And what amazes me about that is that having checked to see how the system was functioning as it relates to triaging patients from A&E onto wards, where there's clear disaffection that too many people are waiting for beds within the ward space. The management tells me that having gone on the wards to check, there were 50 available beds that could triage patients from the A&E onto the ward. And I asked the question, who is managing the bed function, the triaging function? Where is the communication? That's just one example. Where interns are saying they don't have facility and they're working long hours. Interns are supervised by house officers, by residents who are pursuing advanced courses, ultimately by consultants. And in the case of the University Hospital of the West Indies, interns are outnumbered by the hundreds by those other staff. And there's a roster, but it requires management, it requires leadership. I am prepared to say, without fear of contradiction, that we don't have all the resources that we need. But public health has never had so much resources assigned to it any time in our history since independence. Resources of dollars and cents, resources of people, 24,000, largest budget ever allocated. It is now the human element that has to change its mindset to adjusting to getting the best value for patient care. It is now the patient or resident who has to adjust their mindset in order to lead lives that gives them the best chance of longevity and quality of life. And so, I am of the view that the real challenge we face in public health today and in the years to come is not even about our attempt at modernizing. Because if you put the same attitude in the new hospital or health center, patients are still going to wait, still going to complain, and many are going to come because, of course, they're not subscribing to the chronic care model or the Jamaica Move app, as the case may be. We are in a war for change in mindset, values, and attitudes. It is about the social determinants of health that starts with us, first and foremost. And the challenge to healthcare and the leadership that we should bring to this process at this point in time, at this period in our history, is that we have to make the change start with us. It's not always a money problem. And that's another misconception that we need to literally mash down. Because every time a problem comes up, you hear, so we need more money. You cannot throw money at a problem if you don't intelligently approach the challenge and solve the challenge, starting with intellectual capacity. And that's what we're challenged to do. Whether it is in procurement, whether it is in maintenance of equipment, or whether it is in customer service. Yesterday, someone sent me something from a hospital in this area, well, let me not say, in one of the parishes in the corporate area. A fan not working, and it's hot. I don't know how much it takes to fix a fan, but if you have a management system in place, parish managers, find a way to fix the fan. Why should that become the minister's challenge? And if procurement is not responsive, find a way to deal with procurement. So let me close by saying, as I said to the 13 public bodies 3 days ago at the Pegasus Hotel, we have embarked on an accountability framework. And I want everybody to understand what that means. It means that with rights, as argued by our unions and management, must come responsibilities. And those responsibilities apply as much to residents in terms of the role they must play for themselves as it does to staff within the healthcare system. It is not enough to excuse the problem away. It is not enough to say the problem is because we don't have no money. Because more often than not, it's not about money. It's about leadership that motivates, that addresses contexts of problems and fix them. And it's about management and holding management accountable. And frankly speaking, those who cannot perform should move out of the way to put people who can perform. And I think that's where we are. Because guess what? I am at this stage now where I've been served 10, 11 years. I serve at the Prime Minister's leisure. And he serves at the leisure of the people who vote for him every 4 to 5 years. And myself. We don't have any choice now. People want to see performance. They want to see attention. And when you would have done that, if people want to go live wayward and get NCDs, then they must be told that too. If you drink rum, an energy drink, salt, sugars, and fats, and smoke, then expect that one day you are going to end up on a stretcher. We need some plain talking now, because I believe we are frustrating ourselves or buying too much into the illusion that the solution to health is that we're going to build new buildings and everything is going to be better off. It's not going to work if the mindset don't change. So today I say to you, let us work together, but let that change start with us. If the change starts with us, we can lead a bigger change at the level of communities. And that's why my sectorial focused on families, communities, and the social determinants of health. Because we are at a pivot point as we speak. This year, next year, people in St. Catherine are supposed to complain about hospital, building, because Spanish Town is going to have a 6-story building, 5 new operating theaters, an A&E that's 3 times the size of what it is now, more doctors, more nurses. What people are likely to complain about is the quality of the service. We need to start practicing better service quality. Otherwise, this is wasted effort. And I really hope it's not. Thank you very much.
Thank you very much, Dr. Tufton. Very compelling address, very compelling sharing. You know, I took note, Dr. Tufton, I took note, you know. I took note. You see, I take off the jacket? You know, we have to take personal action. You know, we cannot blame everything outside of us. I come here, the place hot. Me in a tie, me in a jacket, and me a complain. I can do something about it. I took off the tie, and I took off the jacket. I have to change my mindset. Somebody make some nice sauce, man. We have to change our mind. It's a very important thing to change our mindset. And I'm happy that he reminded us that we are not there yet. But we're happy for the new building and the expanded space that is coming, because infrastructure is very important. Please, can you help me give our leadership a rousing applause for reminding us of the importance of personal action. All right? Okay, now, I want to invite for those persons who are important part of the Chronic Care Connect launch to come for a wonderful photo opportunity right now. Photographer, are you ready? This is a nice photo moment. You know, before the football match, we take a picture, and after the match, we win, we take a picture. So come. So I want to invite Dr. Tufton to return, and Dr. Alafia Samuels, Dr. Brian, and Terry Frith, yes, she prayed for us earlier, just to come for this first photo op. If you could just come for the first photo op, Dr. Tufton, Terry Frith, Dr. Alafia Samuels, and Dr. Brian, Dr. Tamu Davidson, and Dr. Nicolette Henry. Please come for this Chronic Care Connect app. After that, I want to take another photo for the Jamaica Moves Up. They are coming onto the stage now and making their way. All right. At 5 p.m., we have a match on later on TV if you're watching football. Which team playing? I don't know. My team not playing. All right. Remember to download the app. The QR code, it's actually on your program, and it's on all the screens here. And Dr. Simone Spence, please come. I want you to be in this photo also. Dr. Simone Spence, awesome. Remember, take out your phone, find the QR code, it's all over the place, and just scan the QR code and download the app. It's going to be very useful for the management of some of these chronic conditions. All right? Wonderful. Here we go. Wonderful. Awesome is the word. Photographer, can you see everybody? All right, hold on a second. Just to represent Chronic Care Connect, just hold hands, just symbolically represent connection. Wonderful. Yes. Nice. Wonderful. Awesome. Now, Dr. Tufton, please remain. Dr. Tufton, please remain. Dr. Tamu Davidson, please remain. And Mrs. Terry Ann Frith and Mr. Rodriguez, Dr. Nicolette Henry. This time, it's for the Jamaica Moves up. We're going to get the Jamaica Moves. Yes. Jamaica Moves up. And this is the QR code. Remember, you can scan it and download the app right where you are. And by the way, the app is free. You don't have to pay any money. Wonderful. Awesome. Awesome. Thank you very much. Yes, this. Bless you. Thank you, Minister Tufton. All right, so I want to thank all the dignitaries and all the partners and the team members, the media, and the entire community that came out today. We want to remind you that we have some refreshments at the entrance. There are free health checks here. Remember, download the app, and there are some exhibition and exhibitor booths outside. But we want to invite some stakeholders who are going to be here for the town hall, which will come up right after this. In fact, the moderator for this section or this segment of the launch is Dr. Jacqueline Wright James, Senior Medical Officer of the Spanish Town Hospital. And she's coming and she will be leading the town hall session that is going to be happening right now. But do remember that we have refreshments at the entrance for all of us here to refresh yourselves and get some water. Drink water and mind your own business. God is good and all the time. Wonderful. Let's invite our moderator, Dr. Jacqueline Wright James, SMO of Spanish Town Hospital, who is coming to lead this segment. And we won't charge for dancing. If you feel like you want to get up and dance.
Everybody leave it, but I hope you're just going to look at the boots and come back inside. I see everybody mass exodus. So make we sing together. And who said life not on anymore? And every man got his struggle. To view the boots and come right back on it, because this part is also a very important part, a very engaging part,
a very interactive part. So we want to see all of you coming back inside. We're going to get you out of here before 5 o'clock. I likewise don't know which team is playing, but come back on in, please. My name is not IT. I have no jokes to give. I'll keep you laughing, but I think because of the nature of the afternoon session, I think that is enough to keep you engaged. So, bathroom break, walk break, stretch break, make the coconut break, whatever break it is. But please, I'm going to ask you all to come back inside, giving you about 5 minutes to come back in and take your seat.
5 minutes and return. And remember, the town hall is free, the refreshments are free, and you're free to engage. All right?
Free. And remember, the minister says it's not about the dollars. It's about how we interact, how we behave. And so I want to see you all come back inside. So, because we don't want to end up with the NCDs, do stretch, do walk, do what you have to do in the next 5 minutes. And see you all back. I want to see all the seats full. Get your community members to come on in, because it's an opportunity to be engaged, to ask a question, to get some clarifications, to give your opinions. And it's very important when it comes to big projects. These projects are for the community. It's a big project. And so we want everyone, bring the community out, please. We want to engage them. We want to see the seats filled. I'm not so sure what's the capacity here, but looks like a few chairs, and I see chairs on the side that can be pulled out too. So please come on in. Maybe we can get some more music that might attract them. So
Yes, man, some more music. Some more music in the meantime while we gather ourselves and return. DJ, drop it.
Girl this morning, and she was beauty to my eyes. I asked her where she from, she tell me in the tropics. She asked me what's my name, I tell her I am Connie. And I said
about. So, my name is Dr. Jacqueline Wright James. I am the Senior Medical Officer for Spanish Town Hospital, and I have been given the privilege and the responsibility of being your chairperson for the afternoon, and certainly to guide you through this part of the program. I ask everyone to please be seated. We still have quite a few. My mom would say don't be bashful, but the word is bashful. And please come on up even to the front row. We may need to be connected with but we won't be on silent or vibrate so that we can stay focused. The objective of this meeting, really, we're hoping to create a platform, direct and transparent communication between you, our valued community members, stakeholders, and virtually the members of the project team. Gentlemen was asked, what are we going to be speaking about today? But certainly it's about big things. It's about upgrade of our various health facilities, all within the parish of St. Patrick. And I say it's a big deal because it's an upgrade of 3 health centers, and certainly the minister would have told you about the Spanish Town Hospital. I boast and I say to everyone that it's going to be the White House of Burke Road. I mean, it's going to really stand out. And of course, it's not just infrastructure, it's all about change of structure, improvement in capacity, and ultimately improvement of service to the people of St. Catherine who so richly deserve good care and quality care. And that's what this is all about today. So we're here to hear your concerns, we're here to get your suggestions, and we're here definitely to hear your opinions. And the most important part of this afternoon session is that 1 hour session which has been allotted for questions. That should happen, well, not so sure what time, but the hope really is to get us all out of here by 4 o'clock, the latest. But nearer to the end of the program, that's when we will have the interactive session. So definitely thank you all for being here. Thank you for your cooperation. And officially, really, let's get started. So as we begin this important engagement, we will now invite the presence and guidance of our Almighty. And we will begin with the opening prayer to be led by, I had seen Bishop earlier, so to be led by Bishop Dr. Junior Headlam. And he's from the Church of God of Prophecy, Old Harbor Road. Bishop, the floor is yours.
Thank you very much, Mr. Chairperson. Let us pray. Heavenly Father, we are so thankful this afternoon for the opportunity to be here in this place. Lord, not for the first time, many of us have come to this place for different reasons, different circumstances, certainly always to advance the welfare of our community, of our city, of our parish. Lord, we pray that as we gather this afternoon, this very, very important gathering, Lord, where we are talking about the health of our
right, thank you very much, Bishop Headlam, for that prayer and for your continued spiritual leadership in our community. So certainly as patriotic Jamaicans, we're gathered for a very important talk today. It's a national project. It's probably one of the biggest in the last 20 years in public health in terms of improvement of infrastructure. So I'm going to ask you all now at this point to stand. Let us now stand for the singing of the national anthem. Ladies and gentlemen, please rise for the national anthem of our beloved country, Jamaica. Should we sing a cappella? I always feel so proud wherever I go when I see that black, green, and gold flag flying. I mean, it really gives me pride and gives me joy. I'm happy to be a Jamaican here and to be celebrating and speaking about all the big things today. So thank you again. You're already seated, so thank you so much for being here. And certainly this is part 2. I know that most of the dignitaries were welcomed this morning, but I know we do have special guests amongst us, and we certainly want to welcome you all, including members from the Ministry of Health and Wellness. I'm seeing our parish manager for the parish of St. Catherine. And basically, I don't want to omit any names, but I'm also seeing the Chief Executive Officer for the Spanish Town Hospital. I'm seeing members from the CMO's office, Dr. Heather Reed-Jones, and also Dr. Prosper Chen. So everyone, you are special here today, and I certainly want to invite, to welcome you all, and certainly any members of the media that are present. So once and all again, good afternoon. And on behalf of the Ministry of Health and Wellness, Spanish Town Hospital, all the health facilities in the parish, certainly want to extend a warm welcome, and literally warm welcome to each of you here today, community members, stakeholders, partners, special guests. Today's forum is entitled, I had a little difficulty calling the program because the parish, the city is Spanish Town, but it is a town hall meeting for Central Spanish Town, and certainly we're going to be featuring, you will hear about it, all the various health facilities that are going to be upgraded or have begun upgrading. So we're going to be updating you as to where we have reached with that. It falls under the Health Systems Strengthening Program, HSSP. You will hear that acronym very frequently today. And this is a branch of the Ministry of Health and Wellness, supported and funded by, all of you must know by now, by the IDB, Inter-American Development Bank, the European Union, to the tune of multi-million or multi-billion, depending on which unit of currency you are thinking of, whether Jamaican dollars or US dollars. So it's massive, and it will have a significant impact on the future of Jamaica. And you will hear, I'm very excited, I'm very happy, I'm very expectant with regards to the transformation of this parish in terms of health that lies ahead. And I'm looking forward myself, and I'm sure many of you, to the completion of the scope of work of all the various hospitals. The aim of this is to really strengthen health services and ensure that the people of Jamaica, the people of St. Catherine, are able to access safe and equitable health care. So I gave you my name already, so thank you for taking time out, and we certainly will be giving you an opportunity, as I said, probably within the next hour or so to ask all your questions, to get clarity on anything that you may want to know about, and to give your opinion in a most respectful way. So your presence really matters here today. So thank you very much. So we're going to go right according to the program. For those who have the program, it's okay if you don't have one in your hand. I will certainly aim to guide you. So we're going to be hearing from some persons who will bring greetings, some distinguished guests. And just a quick reminder to my greeters that you have 2 minutes. I'll give you a cue at 1 minute, and then I'll give you a cue at 30 seconds. I'll just knock my watch, which means time to wrap up, because we want to keep things moving, and we certainly want to save time for the questions at the end of this, which is probably the most important part, the meat of the matter. So, so remember to keep your questions, jot them down. Some of you already have questions coming into the forum and may have questions as you listen and hear what's being said. So jot them down so you can remember them all at the end. So our first greeter, I'm not so sure, it's supposed to be coming from the Jamaica Constabulary Force. I know they weren't here when we just started. I don't know if they have yet arrived. I'm not seeing anybody moving, so we'll move right ahead and go on to our next speaker, who really should be Miss Juanita Reed, and I think she's here. So we want to welcome Miss Juanita Reed. You can make your way to the podium. She's a Deputy Executive Director, Community Research Development Planning and Program from right here, the Social Development Commission. And so we want to just make her very, very, very welcome. And Miss Reed, remember the timeline. You have 2 minutes. So over to you, Miss Reed.
Good afternoon, everyone. Minutes. So I'm just going to say all protocols observed and go straight into what I'm going to condense. It seems like about 3 minutes, but I'll take 2 minutes. So on behalf of the Social Development Commission, it is an absolute pleasure to send you greetings on behalf of SDC at today's just in case anybody else has for the health strengthening project. And you hear already it's HSSP. Now, why is SDC a part of this project? And it's a partnership with the Ministry of Health and Wellness, and we are actually implementing a stakeholder engagement strategy to foster meaningful interactions, to build trust, and achieve sustainable outcomes in targeted communities under this project. The approach we are using supports the implementation, the rollout of the implementation of new and upgraded health facilities, some of which would have been mentioned already. And we are here to ensure that communities and key stakeholders are informed, consulted, and actively involved in the process. Now, SDC is your leading community development, community engagement agency. Okay, and our primary mission at the SDC is to ensure that your voices, your insights, your needs sit at the very center of all projects, national projects of this nature. We are glad to have you here today. We have our political leaders, representatives, community members, business operators, local leaders, dedicated healthcare professionals and workers, and right across from the St. Catherine area, and specifically our communities of Spanish Town Central, Ensom, Greendale, Hampton Green, Comarty, Golden Acres with us this afternoon. Now the physical expansions and service upgrades taking place here at the Spanish Town Hospital and St. Diego and others, they are not just about fixing some buildings for you to access medical care. They are about directly transforming health, well-being, longevity of every family in our surrounding communities. Now we know true development cannot happen in isolation. It requires a strong, active partnership between the Ministry of Health and Wellness, our dedicated healthcare professionals, and you, the residents, who are a part of this gathering this afternoon. Today, we'll share data and progress on the upgrades being made at the centers, but more importantly, we are here to hear from you, to listen, to hear your concerns, to get your recommendations, and we want to have you fully informed, especially that we have to all work together to strengthen our collective fight against non-communicable diseases, NCDs, like hypertension and diabetes. I just want to quickly, before I move away, just use the opportunity to acknowledge the work being done by the STC team in ensuring that the stakeholders are engaged. Many of you here would have been involved in some of our social service fairs, our pop-ups, so it's good to see you again as we continue to work. So I want to really thank our team on the project, our director led by Miss Sharon Walker, our director of governance, our parish managers for both Greater St. Catherine, Portmore, our other community liaison officers, our field staff, all of who have been working tirelessly in the field to promote this program and to get you involved. So as stakeholders all, I want to thank you for your presence, your time, your voice, your commitment and passion, and your partnership. Let us work together to build healthier, more resilient communities and a stronger Jamaica for each and every one. I look forward to your participation. I look forward to a meaningful engagement, and I look forward to overall success of this town hall meeting. Thank you all.
All right, thank you very much, Ms. Reed. And thank you very much to the SDC for your continued work within the community. Just a little bit over the 2 minutes, so we're not going too badly at all. Dr. Prosper Chen, could you make your way? Oh, I think I'm seeing our senior superintendent, Hope Town without an E, Nicholson, who is the commander of certain of the St. Catherine Police, North Police Division. He's a hardworking, can you make your way? Sorry, I need to catch your breath. All right, hardworking, dedicated, and committed Jamaican. So let us certainly welcome Senior Superintendent Hope Town Nicholson. Over to you, sir. You have 2 minutes. Thank you for coming.
All right. Good afternoon. Good afternoon, everyone. All protocols observed. As close as I am, you see, I got here late because when duty calls, it calls. Just want to acknowledge all the persons that are here. I see person on the Ministry of Health, senior person from the Fire Brigade. I see political representatives, and quite a few. I saw Dr. Prosper Chen outside. I am happy to be in such good company. Good afternoon, Ms. Lewis. I'm happy to be in such good company. But in a nutshell, 2 minutes is not much to speak of the largest division in Jamaica with the most police stations, 14. Good afternoon, Ms. Ellis. 2 minutes is not really enough. But just to say that we have embarked on a strategy which includes multi-stakeholder engagement, and it appears to have been working. We focus on public order and enforcement. It's not at its best, but we are reaching somewhere. We focus on pursuit of high violence producers, or high-risk targets we call them, persons who contribute to violence. We focus on stakeholder engagement, and we also focusing on paying attention to minor crimes, which we want things to be nipped in the bud before it gets too to such an apartment a point where we cannot handle it or it gets something. So things like threats, disputes, and so forth, we pay keen attention to them to ensure. And at this moment, St. Catherine North, for the first time since its inception in 1996, 30 years exactly, we have seen the lowest number of murders. We're talking about 18 compared to 27 last year at this time. And last year at 27 at this time was the lowest since the division was formed. And like I said, it's not something that we want to pat our shoulders on because we wish it was zero. But as police officers, we do not control all the variables that contributes to murder. But we are consistently ensuring that we do the best we can with what we have, wherever we are. So St. Catherine North, partnering with all the agencies that we can, engage in the communities to see how well we can police them, because the truth be told, we try our best to police with consent. We want areas that are of concern to us. You will see more police there. And the medical experts will tell you that even if when they are at the hospital, if they are dealing with a sprained hand and somebody coming with a gunshot wound, the sprained hand have to wait. They try to save lives. So sometimes when you don't see us, it's not because that we are neglecting you, but sometimes some other areas require more of our active presence. And so we try to minimize the threat to expand. Recently, we had some issues with 2 areas, and I'll just give you a quick update. We had issues with Marshpen and Quarry Hill. Since October last year, St. Catherine North has never recorded 3 murders in a week. As a matter of fact, we have not recorded more than 3 murders per month since October last year. Never, we're not used to it. So when you see week before last, when we had 4 murders within a week, we know we planned that we're not going back to where it was. So Marshpen flared up, Quarry Hill flared up, and I can tell you as of now, about an hour ago, that last murder, that 18-year-old Bingy who was shot and killed, 2 persons have been charged just about an hour ago. Unfortunately, one is a 15-year-old boy. Unfortunately, one is a 15-year-old boy, and the other man 20 years older than him, 35 years old. They will have to go and answer to the judge as to why they committed that crime, but they are properly before the court. They will be going before the court, and for now, I can tell you, the only way they can come out unless they escape custody, and they won't be able to. So we are hell-bent on trying to keep this community safe. St. Catherine North, for those of you who don't know, starts from Jose Marti all the way down to Macookspin to the St. Andrew, St. Mary, St. Anne, and Clarendon borders. That's how we are wide, the largest police division with the most police stations. And we hope that we will work together so that the space can be safe and you can enjoy with your families within the division. And St. Catherine can be the pearl of Jamaica, and all of you would want persons to come here to live, to work, to raise families, and do business. Thank you, and as we continue to work together. Thank you very much.
Thank you very much, Senior Soup. I know we had to give you a chance to catch your breath, but I think we certainly appreciate it, certainly as parishioners here in the parish of St. Catherine, for your commitment to safety in our parish. We heard the numbers, 18 versus 27, and I heard some clap, but I think that deserves another clap. We hear the work, we see the work, we feel the work, and especially coming from Spanish Town Hospital, which is one of the 2 hospitals in the parish of St. Catherine, we can see that the numbers have come down with regards to trauma in that area coming into the hospital. So we thank you very much, Senior Soup. It's very important that we feel safe. And you can see this town hall is all-encompassing of every aspect of our activities here in the parish of St. Catherine. So thank you once again. Dr. Prosper Chen, we're going to be calling on you again. Dr. Prosper Chen, please make your way up. You want the mic? Please make your way up, come on. Give her a clap, welcome her, make her feel welcome. She is the senior medical, I see you looking, yes, Doc, you're supposed to bring greetings, 2 minutes. She's the senior medical officer for the parish of St. Catherine, the St. Catherine Health Services, and she's a chief advocate for best practices. She's all about planning, all about preparation, all about making sure we adhere to the practices. So over to you, Dr. Chen.
Good afternoon, everyone. Today we're going to hear your questions and concerns about the St. Jago Park Health Center and the expansion that's in progress, almost finished, and how, I'm sure some will ask, how will the service be better? I will tell you this. The new facility, when you walk in, and I've been in the facility without persons in it, it's a very wide space, a beautiful space. It's quiet right now, but guess what? We are looking forward to the rush of activity. So we are looking forward to the purpose of that health center, which is to serve the communities. You know, we struggle in this parish with facilities that are old. They are not built for purpose, some of them. They have infrastructure challenges, which we fight to correct on a daily basis. But it has not dimmed our commitment to provide that service. Once St. Jago Park is up and running, then the same chronic illnesses that we speak about are where the service will be most improved. So we will have expansion of the lab so that you don't have to go to Spanish Town Hospital to get a test done. You might have to go for one of those special tests, but we are hoping that we will be able to satisfy that need. We will have privacy, confidentiality by having more physician offices. We are going to expand the mental health area, and so that will also be more comfortable for patients who seek that service. Our commitment to improving the service for all patients is what this is about. Yes, our concentration today is with chronic illnesses, with the Jamaica Moves and the two apps, Jamaica Moves and Chronic Care Connect. But I think as physicians and as management, our primary purpose is to improve the service for all persons and whatever service that you are coming for. And that is our commitment to you too. That whether you come because you're pregnant, if you come because your life just hard, you know, sometimes life just hard and you just need somebody to talk to, we should be able to provide that service. And that is where we're going with the expansion of the 3 health centers in St. Catherine. And that's Old Harbor, Greater Portmore. Oh, in fact, Old Harbor is a new health center. Greater Portmore and now St. Jago Park. Not only are we going to get a new building for the chronic illness, for the curative service as we call it, and to expand the maternal and child health, we are also going to get rehabilitation of the original health center. I don't know who go to Jago Park now, but just imagine Jago Park Health Center now, and in a few months, when we have done some rehabilitation work, it will be a space that should be welcoming, and it should provide a service that welcomes you. Thank you very much.
Thank you very much, Dr. Prosper Chen. I mean, I'm feeling so happy. If I could sing, I would sing, but I won't. I can actually play, though. I can play an instrument, but I can't sing. But with all that you have said, it's music to all of our ears. And I want to do a pre-test. Let me see if you're listening, and based on what you will get spoken to about later, can you name me anybody? There are 4 facilities that would have been mentioned. I want to hear the name of the 4. 3 health centers, I'll help you, and 1 hospital very nearby. So, very easy question. Huh? Greater Portmore, yes. Old Harbor, you said at the back? Old Harbor, yes. The next parish to be added to Jamaica. Did you say it? Greater Portmore, and right next door to the hospital, I don't think I heard that name called. St. Jago. and it's all about aesthetics. It's going to be beautiful. When it's finished, it's going to be, we'll just walk, we won't even feel sick anymore, because just looking at the building, I think, probably will help us. And coupled with the movement, Jamaica Moves, and coupled with the Connect Care, I know we're all going to look after ourselves. We're going to ensure we get the 6,000 or the 10,000 steps per day, and we're going to take our medication. We don't need to go to hospital anymore because we're going to be so well controlled. And guess what? You may not even need to come to Spanish Town Hospital, because Dr. Prosper Chen told you that our members who represent us, our members who represent us so well in the political world. So thank you again, Doc. And I want to now welcome Dr. Fenley Douglas, JP, ready and rolling, counselor of the Waterford Division, and representing, I believe, his worship, the mayor of Spanish Town, the councillor Norman Scott, JP also. So welcome, please make him welcome. And Dr. Douglas, you know the timeline, 2 minutes.
Thank you, moderator. I don't know who could ever give a politician a mic and said 2 minutes. Never seen that before, but in the interest of time, we've been here since morning. I just want to state that I will stand on the protocols that were observed earlier, and to state that I'm representing our mayor. Persons that are admitted or who died in Jamaica died from a non-communicable disease, which is a disease that could have been prevented, avoided, or didn't have to go in the same way in which it went. To go further, while the hospital is there, we need to remember that our doctors and nurses, they're humans too, and they're stressed. They're heavily burdened and stressed. But from our day-to-day lifestyle, and I'm speaking on behalf of Norman Scott, who would tell you that from our day-to-day lifestyle, we could change all of that. And let me just encapsulate everything and weave it into one sentence. The young man who ended up at the hospital from gunshot wound didn't have to reach there if the mother, father, or family member did say, change your lifestyle. If the child that loves sweets and eat unhealthy, or the parent that eat unhealthy every day, if somebody had stopped that person, they wouldn't have to end up there either. So most of what we're saying to end up there, it's a lifestyle that we have selected. So I take this opportunity to say to you that let us change our lifestyle in a positive way. The young man that bought the fast BMW and the clock says 220 miles, while our fastest speed limit is 80 kilometers, and he decides to go at 220 and crash and end up at the hospital, he didn't have to reach there. So it is about the choices that we're making. And regardless of what the Ministry of Health wants to come with, we can let them as citizens build the biggest hospital, and we can let the doctors and nurses stand there alone and have nothing to do if we just change our lifestyle. That's it. Our family has mental illness, but we believe we must crash the family out by Bellevue and let it be doctor problem. While all the family member needs is love and family care. So I use this medium in my 2 minutes to say to you, let us change our lifestyle. Let us look at what we're doing from each day we wake to when we go to bed. Eat what is right. Care yourself. Move your body. And let us live to see 99 years old. God bless.
Thank you so much, sir. We want to live to make the century, though. We want to be like Brian Lara, you know, there's several centuries. But thank you so much, Dr. Douglas. You said politician, but sounded like a teacher, sounded like a preacher. And it is all about changing your lifestyle. And we know that Dr. Prosper Chen is a major feature of health, is primary health care, where we really launch into education because we want everybody here to know that we can do something to change the whole health profile of Jamaica. And we're doing it because the numbers show that we are living longer, but we could even live to make the century. And so that's what it's about here today. So thank you so much, Dr. Douglas. I think we can have some take-home words. Get moving, eat better, eat healthy. And if it is that you have high blood pressure, please do take your medication daily, all when you feel good. Take your medication. So thank you. It's about change. And that's what this is all about. Change how we live, change the infrastructure, and of course, change the quality of care and how we show that we care as healthcare workers. So thank you. And could you please extend our greetings to His Worship the Mayor, and certainly we really extend our condolences also, sir. So next up in line is Miss Keisha Lewis. I think I see her moving. Jamaica moves. JP. She's a councillor for Lauriston Division, and she's ably, I know, representing Miss Denise Daly, who is a member of Parliament for St. Catherine Eastern. So Councillor Lewis, I think Dr. Douglas did the 2 minutes or just about. So let's see how, if you can keep in tow with that. So Councillor, make her welcome, please. You have 2 minutes.
Thank you very much. SMO, thank you so much. Good afternoon, ladies and gentlemen. I heard my colleague speaking about eating right and doing the right things. I have no non-communicable diseases. Don't watch the size. Good afternoon, everyone. It is my pleasure to bring greetings on behalf of the Honorable Denise Daly, Member of Parliament for Eastern St. Catherine. I want to greet you all today specifically, as I said, to support an accessible, efficient, and quality health care for all. She encourages everyone to actively participate and share concerns and engage in meaningful dialogues. As a councillor for the Lauriston Division, which sits right on the edge of this community, I want to also recognize the importance of these improvements to our facility and how it will improve the lives of our residents who rely on the Spanish Town Hospital and the care at the health centers for their benefits. And so as we gather here this afternoon to engage in meaningful discussions, I want to ask us, let us think wide. Let us think and act wisely when we make our decisions as it relates to how it is that we want to also see our healthcare sector. Our councillor earlier spoke about how we live our lives. Let us take that into consideration. Our police officer who spoke earlier, he may not have touched on it, but crime and violence is a serious factor that impacts the operations at our healthcare facilities. And so today, as we gather, and on behalf of our Member of Parliament, Denise Daly, I hope that we can continue the partnership, continue the dialogue, and remember that with dialogue and partnership comes development. Thank you all very much.
All right, well done. I believe you will get the prize. Bang on target, 2 minutes, Councillor Lewis. So thank you so much for your representation, and certainly give our thanks to our Member of Parliament, Ms. Daly, who was listening, which I always have a little challenge with how the parish is divided. Where is east, where is north, where is south, we have west? I'm sure we must have west. But which part of St. Catherine is the Spanish Town Hospital in? I learned that just a while ago. Let me see who was listening. East. Yes, yes, yes. All right, so we're getting closer to the 5 o'clock. I see Mr. Messi in the crowd. You're for Messi? I don't see anybody else repping their country of choice, not because Jamaica never made it, but, you know, we do have, we're all football fans at heart. So thank you very much, Councillor Lewis, for those words. So going according to program, I believe that our final greeter will be ably represented, but certainly our final greeter should be, is the representation here for the minister? Can make their way to the podium. So the final greeter for this segment is a veteran politician, a champion for culture, a champion for community development and redevelopment, a dedicated advocate for St. Catherine, and I think now it's for Central St. Catherine, am I correct? Yes. A distinguished public servant, a steadfast supporter of healthcare in St. Catherine, and I know you know who I'm speaking about, and certainly the most Honorable Olivia Babsy Grange, OJ, CD, MP for St. Catherine Central, and I think she'll be represented by Mrs. Teresa Turner Flynn, who will also give greetings on behalf of herself, but also on behalf of our veteran politician, Honorable Olivia Babsy Grange. Over to you. Thank you. 2 minutes. Well, we'll give you 3, since you're representing yourself.
Thank you, Madam Moderator. I was about to, all the accolades that you were dishing out as it relates to the minister, I was about to tell you that I'm not the minister, but I am yours truly, Teresa Turner Flynn, JP, Councillor for the Hampton Green Division. I just want to observe the protocols this afternoon. But I want to tell you, I am such a proud Spanish-Tonian. Yes, we have our little tits and bits. Yes, we have things that we should tweet. Yes, we have our worries and our troubles. But as it relates to what we are doing with healthcare at this time, I am a proud Spanish Town girl. I will not deter from that. You know, sometimes I'm driving past and when I look up and I see these massive cranes in the air, I'm saying, wow, something good is happening in Spanish Town. Yes, I have my run-ins with the Spanish Town Hospital, and I hope that when we complete this building, the behavior of our family members, the behavior of our patients, the behavior also of some of our doctors and nurses, because I have my run-in already at Spanish. I remember there was a time that I was so sick, and I was taken to Spanish Town Hospital. And could you, Madam SMO, you know what the doctor said to my family? Tonight, me not look off and nobody will now walk. Walking patient me I deal with. And I was extremely sick. I spent 7 days in the hospital when he decided to look at me. So the behavior of our families, the doctors, the nurses, has to change. If we are changing the aesthetics of the building, we need to change everything across the board. So, as a proud Jamaican and a proud woman of St. Catherine, a proud political representative, and a proud Spanish Town girl, I am saying to you this afternoon, let us, when we get these facilities, take good care of them, deal with our nurses and our doctor better, because sometimes patients and them family deal with the doctors them and the nurses them really bad, you know, and we must admit that. So let us change, not even our lifestyle, as Dr. Fenley Douglas says, because I know persons who are vegetarian and they are very sick now. So I don't know about the lifestyle, because as I said to my doctor, anything you season up and it smell good and smell nice, I will eat it. But this afternoon is for us to understand what is happening as it relates to transforming our healthcare system. And we are willing to ask questions, Madam SMO, and we want good answers. Thank you very much.
Yes, you did very well. My phone I had the phone on the timer for 2 minutes, and it actually just went off. So congratulations, and thank you very much. We're on your page, madam, that it's all about change. It's change about the infrastructure, because I believe aesthetics is very, very important. It does help to build morale, and I'm looking forward as the SMO for Spanish Town Hospital to that wonderful building when it's completed. But it's also about change of us, change of the care. We do have good persons, but we do know that the weakest link, certainly a team, the weakest link is what sometimes frames the team. And we believe that that change must come. Change is coming. Change is happening. And we also believe as a team that we don't know, you're really not interested in how much we care for you or how much we know what we need to do until we show how much we care. So we're on the page with you in terms of change, a complete change in every aspect. And we're promising you that. We're working on it certainly as an entire St. Catherine parish. So thank you once again for your words of encouragement. So my heart is full too. I mean, I could talk here for the whole day too, but of course I have to stick within my time. But sometimes when you're so happy, when you think of what the good is to come out there, it's hard not to just almost have verbal excess because your heart is really full today. But we have to stick to time, stick to our program. So thank all our greeters today. Thank you for all your words. And if nothing else, change is here, change is coming, and we're working on it together as a team, entire team. Everybody's role is important. So we're going to pause for a moment now, according to program. Moment of cultural expression. Is my musician here, Mr. Fletcher? Yes, I see. Look like the phone is timing me too. But music certainly soothes the soul, and it reminds us of the community spirit that we are trying to build here, because we can't do it with one person. Everybody are very important in this movement here. So let us make welcome the young man, Mr. Raheem Fletcher. And I want to tell you, my mother's name is Fletcher too, so maybe who knows. But he's a saxophonist, and he's going to render a musical selection. I was, mic check. Right, I was so lost in the music. When I heard the clap, I realized, boy, that was beautiful. I mean, I wish we had more time. I would certainly say encore, encore. Music always brings out so much in us, whether it's a smile, whether we move, whether we start singing, and I think I saw all of that happening here today. Thank you so much. That was superb. And I know we know the name of that song. What's the name? Yeah, man. We want another, give us another little frill again. Just even the last part. Forgive me, organizers. I know the time. There. Sing with him. One and all. Yeah. Harder they come, the harder they fall. All right. Thank you so much. Beautiful, beautiful. We could sit and listen for the entire afternoon. Jamaica full of talent, though, you know. I mean, we can sing, we can run, of course. We can play music, and we play every instrument that exists. I mean, my son did music. I didn't even know something was called a marimba. But we really are a talented country, and I believe that we accomplish so much, especially when we put our minds and work together. You know, I mean, we may not always agree, but disagreement is fine, but we must work together for that common goal, that good. And right here, we're all about health care and what good lies in store for us. It's good, you know, but it definitely, we're excited about better. So thank you again, Mr. Fletcher. That was beautiful. I'm going to do my roots and see, because my mother's name was Fletcher. All right, so ladies and gentlemen, let's shift now to the heart of today's update. How our time looking? It's 2:35. What time is it? Is the next match, Mr. Messi? Mr. Sir? What time is it? That's Argentina, right? You don't know? Because Argentina not playing today. But Argentina has won their 2 matches. Eh? They're not playing today. All right. Who knows what game is playing today? Which? Brazil? Wow. So we have to really wrap up. But this is such an important afternoon. And as I said, we are at the heart now of today's updates. Largest investment in public health, I want to say confidently, in over 20 years. And this is no longer a dream, but it is becoming a reality. And we want to hear the timelines, because we're anxious, you know, we want to move into that building. I'm from Spanish Town Hospital. I'm anxious to move in there before the gray hairs take over. And I know that you're going to give us the timelines. The health centers, Dr. Prosper Chen can't stop smiling. She said St. Jago Health Center pretty already. It's almost finished. I think there's some opening about to happen this year. So we're going to hear all of that. So I did start off by saying it's a big deal. And we're not copying. I don't know if I have the Copyright Act, but KFC doesn't only own the big deal. This is a big deal here, and that's what we are here to speak about this afternoon. So is Miss Frith in the house? We're going to ask her to move forward. I think that's where we are on the program. We're going to be moving, is Miss Frith? Moving to an overview of the St. Jago Park Health Center project, what's planned, where we are, and certainly the milestones. We want timelines, you know, and she's behind me. Ah, Miss Frith, somebody pointed you out to me. So welcome to you, Miss Frith, Mrs. Terry Ann Frith. She's a procurement specialist for HSSP. Who was listening earlier? What does HSSP mean? I want to hear from the front row. Not you, Counselor, not you, Doc. All right, Health System Strengthening Program. So over to you, Mrs. Frith. I think you have a little extra time. I think you have 5 minutes. So over to you. Thank you so much.
Good afternoon, everyone. Thank you so much, Chair. And I am Terry Ann Frith, as you heard. I hold many different capacities. Some of you know me as Mrs. Frith, the lawyer. I serve as a procurement management specialist, but today I am especially pleased to be with you on behalf of our program manager, Mr. Ort Clark. Now, I'm just here to give you an update on the health system We're talking about expanded consultation, dental and maternal care areas with new medical and dental equipment, furniture and technology are being procured now. The electronic health records will be available from the very first day it opens. St. Jacob Park has been designed as a modern health center. It is a benchmark for community health care in Jamaica. Let's talk about the Spanish Town Hospital. This will be completing in 2027. And I know everyone is watching the Spanish Town Hospital closely because this is a new building. It is 40
All right. Whew. Thank you so much. Boy, my heart full, 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 full. I'm so excited. I mean, I heard the word used so many times. Built for you, designed for you, opening for you, all about you, you, you. And that is what we do here today. Everything is about all of us. Let me include myself in it too. It's for us. It's for you, the people. For you, the community. That is what it's all about. Trying to offer and improve health care. How much money, she said, I don't even remember those figures there. I don't even know if we can call it, but did you quote in Jamaican or US dollars? US? Woo! How much she said? Is it, huh? 11? 11 million? Huh? 148 million, I think you get the prize. US, remember to say the currency, not Jamaican. I would love to get 148 million Jamaican right now, but this program overall cost, if I'm getting it right, if not, please correct me, 148 million US dollars. I don't think I'll see that in my lifetime, but that is what the project, this program costs. And so many aspects to the program. How far did she say that Old Harbor has reached? Old Harbor sounds like they have the prize, high marks. 90, boy, I wish I had some prizes to give, but yes, it was 92% and should be opening in 2026, and we're going to hold them to that. You know, I mean, the ministry is introducing what we call performance management, and we have to meet the deliverables that we are meeting, and so we're going to manage them. They have to get 75% to pass, and we're going to hold them to it. Community, 2026, Old Harbor Health Center, please correct me, Greater Portmore and St. Jago will be opened in 2026, not 2027. And what year are we in? 2026. So boy, I'm looking forward to this. And there are so much aspects to it. She spoke about 4 areas to the program. She said it's going to be on time. She's committed to that. It's going to be full of all fancy equipment. CT, what else? MRI, it sounds like even Old Harbor might get certainly an X-ray machine. And we did say Old Harbor would be, oh wow, who said they want 48 million? US, come, give us your name, where you're from.
My name is Karen Johnson, I'm from the Lindsay Division. Okay, how I feel about today. I might jumpstart my question because I just want all of this for Linstead, really.
Well, Linstead, but remember we are one parish, one St. Catherine, so whatever is for Spanish Town, whatever is for Old Harbor, whatever, well, Greater Portmore kind of far, but Linstead is definitely a part of it. We're one family. We're a family. Who else said the 90? Come quick. We want to get out here so Mr. Messi can watch Brazil and see if there are any competition for him. Tell us who you are, but this is your prize. Congratulations.
My name is Vanessa Harriet Trail, and I'm from Ebonyville in Spanish Town.
Prizes. Who said 2026 for Spanish Town Hospital? More prize? Who said 2026? Huh? 2027. Sorry, who said 2026 for Old Harbor and Greater Portmore and St. Jago? Who is I did? Come, I believe you. Come, tell us who you are, boy. You look happy. You're from Old Harbor? Because you're getting a mini hospital out there.
from Sydenham, Spanish Town, and my name is Jasmine Salome Blake.
Congratulations. You can see that she's happy. I mean, these things just make us so happy. We can't stop smiling. And we saw all 32 teeth. So the timelines are real. We have any more gifts? What else I'm going to ask? I think I'm running out of... somebody said Spanish Town 2027. Yes, come quick, come quick, come quick. We have a timeline. We want to be like the program and meet our timelines. Tell us who you are. I don't see any teeth. 32, I want to see all 32.
My name is Linda Douglas, and I'm from Spanish Town. Hi, Councillor Keisha.
I don't hear nobody saying St. Catherine East or St. Catherine Central or St. Catherine North or St. Catherine South, but that's fine. Guess what? We are one parish, St. Catherine, whether we come from East, North, West, South, or Central. Maybe one more prize. Let me think. How many stories will we see for the Spanish Town Hospital? All right, your hand up. You did everything. You put up your hand for acknowledgement and you answered correctly. So come. My trouble.
Good evening, everyone. I hope you all enjoy this ceremony that the MOH putting on for you. And also, the service that we're providing from MOH is going to be a plus in the St. Catherine community and other nearby communities. All right, so my name is Nicola Lawrence, Environmental Health and Safety Officer for both the Portmore New Health Center and the St. Jacob Park New Health Center. No, but the thing is, I'm not on the Spanish Town project. I am next door, but to show you that I'm intellectually inclined as to what happened next door, I know.
Oh boy, I think you have to go make her the Madam Chairperson for the next program. But thank you so much. You're a Public Health Inspector, Environmental Officer. Last question. Any more prizes? That's it? All right, I see one more prize. What shall I ask? What should I ask? Boy, that sounds like a hard one. That sounds like you should give them the 148 million US. All right, if somebody, whoever first, don't run, move, don't drop, but whoever can come up with the Jamaica Moves app on their phone. You can download it now if you want, but just make sure you come with it. And we should put on a timer because it's almost 3 o'clock. 1 minute to get to, come, Mr. Campbell. You have it? Give somebody else. That's what a parish manager does, He gives it out. He doesn't take it for himself. Wow. Come, I need a judge. Come, Miss. All right. Congratulations. And give us some of the features of it. Have you started using it?
Let me start using it. My name is Stacey Brown. Yes, ma'am. Yes, ma'am.
That's all we want to hear, that she's going to use it. I'm going to use it too. I'm going to download the app and make sure that I use it. But thank you all so much for your participation so far this afternoon. So I think it's just excitement. I mean, we're abuzz with excitement. It's at fever pitch. And we want to see the opening in 2026. It will be equipped. We do recognize that the human resources are the most important, are very critical to the mission. And we're going to get more nurses, we're going to get more doctors, and all categories of staff that are important for the function of this place. It's going to be equipped with electronic health record, and I can give you a little secret. We have started at Spanish Town Hospital, and we are one of 13 sites, I believe, throughout the parish or Jamaica that will have electronic health records. So we're really excited. More services at the institution to just serve you better. Spanish Town Hospital and many of the health centers will literally be a one-stop. We don't have to send you and find ambulance to send you go to KPH or anywhere. The bus stops at the bus or the buck stops at Spanish Town Hospital and Old Harbour Health Center and St. Jago. And because you're connecting with the app, we won't see you in the A&E of Spanish Town because you'll be so very healthy. But it almost sounds like we started the question and answer session already. I see you looking at your watch, so we're moving along. So I'm going to ask my panelists to come forward. Do you know yourselves? Now is the hour. Now is the time to engage you. Now is the time to ask all your questions that you jotted down. So can we have Mrs. Terry-Ann Frith? And we know that she's a procurement specialist for the Health Systems Strengthening Program. Mr. Shaw, Gene Shaw, he's a project manager, infrastructure investments. Come on up quickly. I'm not seeing Mr. Chin, not here, but I know that he'll be able to represent it. Any questions? I'm sure Mr. Shaw can answer all of them. Mr. Huang, please. I think I'm pronouncing it like Spanish, but Mr. Hugh Hang and Miss Nicola Lawrence, both here. Come on up, take a seat on the platform for me, please. Let's get going quickly. Dr. Chen, you have to come again, please. Thank you so much. And based on my list here, Miss Shireen Walker, is she here? Yes? All right. So just to set some ground rules, and we want to hear, I don't know if we have time to literally hear from everybody here today, but everybody is important. Your opinion is valued. Your questions we will try to answer. And that's what this is about. It's an engaging, interactive time because we can't go forward if you're not happy, if you want some clarification. We want, so everybody's here. Dr. Chen, where are you? All right, so we just, when you come up to the microphone, please introduce yourself. Sorry, tell us who you are. And we also want one person speaking at a time. Yes, sir, please come on up. No, we want to keep it friendly, even if we agree or disagree or we have something, that we want to say that, may not have been said. Let's just keep it friendly, but we want to hear from you. We did say to introduce yourselves. And your questions, just to keep us in tune, should be about 30 seconds. I think everyone is here. Do I see anybody coming up to microphone? Maybe I'll get the ball rolling, but don't be shy. This is your opportunity. Ask your questions, whatever it is you want to ask. Come on up, Miss Sydenham. Was it? All right, Mr. Frith, maybe I will, Mrs. Frith, sorry. Anyone coming up? All right, Mrs. Frith, our procurement manager. And you said you're also known as Lawyer Frith. Good. All right, so HSSP, how is it coordinating everybody who is involved in this program, the contractors, the engineers, the partners? How is the coordination taking place to ensure, one, accountability, two, transparency, and steady progress to ensure that we get to our timelines? Mrs. Frith, how are we coordinating? Give us a little insight into that, please. Thanks.
All right, thank you so much for that question. So we have a very structured governance framework for this program. We have all our stakeholders were involved in project monitoring meetings. We have regular site visits. We have monitoring meetings involving all the stakeholders. In fact, for the Spanish Town Hospital, there is a interesting structure because we have what we call a technical working group, which is comprised of an engineer, a contract administrator. We also have a legal expert that really monitors another layer. We have the supervision company. We have the contractor there, and then we have all our project managers across the facilities and those like Mr. Shaw who are inside the HSSP, inside the PEU, who has a responsibility for monitoring those timelines. And you know, all our stakeholders have established responsibilities and timelines, and obviously from the procurement and contract management
Improvements beyond the building. What is in it that will help to strengthen the health service delivery, which is what it's about. It's not just the building, but it's also about strengthening the service that we offer to our patients.
Absolutely. So it's more than, I should say, construction. And ultimately the Ministry of Health, the wider government, is about improving primarily healthcare services and improving health outcomes for our population. So we're getting nice buildings, but within them they represent modern facilities, they represent a supportive environment with improved care. We're giving you the power in your hands as patients to manage your health, that community connection, everything that you're hearing about today at this launch in terms of the chronic care model, in terms of the Jamaica Moves mobile app. It's really about that and delivering that first-class healthcare, system that strengthens our community and improve the health outcomes for our population.
Thank you so much. So you hear it is an all-inclusive package. When you go to those hotels, you get everything. You pay $148 million US, and you're getting every aspect of healthcare. So I do like the comprehensive nature, because sometimes we get the buildings and that's it. But it's not building alone. It's not just a structure. So thank you very much, Mrs. Frith. Don't be shy, thank you so much. Go ahead, introduce yourself and go right ahead.
Good afternoon. I don't think the mic is on. Good afternoon. Good afternoon, everyone. My name is Karen Johnson. I am from the Jamaica Red Cross in Catherine Branch. I'm the Health and Care Section Chair. I'm also from the Linstead Division Community Emergency Response Team. I'm the Secretary. And there's a lot of other things, but I want to stick to just there. I want to first say thank you for doing this for St. Catherine. We are eternally grateful. But I am from Northwest St. Catherine. I'm from Linstead. And I want to take you back a little to ask the question. I want you to understand that mental health is chronic health. I want you to also understand that dental health leads to chronic health. And our health center in Linstead does not have any of those. Neither dental health nor mental health. Our hospital is lacking. And though we see this and we're grateful for it in St. Catherine, I want to ask of you, is there any plans for Northern St. Catherine, in specific, the Linstead Health Center or the Linstead Hospital? Thank you.
Who Dr. Prosper Chen, I see you shaking. You going on, or Mrs. Frith? Anyone?
I was planning to pass the mic to Dr. Prosper Chen, but within the program, the Health System Strengthening Program, we're focusing on just 13 specific facilities. The Linstead is not included yet. I'm not sure what are the plans going forward. We'll have to get back to you in terms of what is the plan generally, the strategic plan for other health centers. But our government is working for you, and where we see the need, we're going to target them and move towards them. You have anything to say, Dr. Prosper Chen?
For Linstead Health Center, the facility will be upgraded under the primary care reform. How much of it, I'm not sure. The extent of it, I'm not sure. We're working right now to get dental back up. You know that Treadways, we had to move into Linstead Health Center because the Treadways building was unsafe. And we're attempting now to, well, we have been trying for a number of years to get an alternate space for Treadways. So some attention will go to Linstead, but it will not be under this program.
She wants a 6-story building. But we thank you for your advocacy. Yeah, somebody, yeah. But see Mr. Campbell behind you there, so have a word with him when you finish. But guess what? It's one St. Catherine, so Spanish Town Hospital is your sister, so. But I understand what you're saying. Sir, over to you.
Thank you very much. My name is Dennis Robotham, St. Catherine Chamber of Commerce. I just want to say kudos to the entire team and the contractors. I was saying to Mr. Campbell, it is refreshing to see a construction of this magnitude. And you pass every day, you don't see any excitement, you don't hear any problems coming from it. And from my understanding, even on the political end, things seem to have gelled so well that I think the project has probably surpassed the time or on time. So kudos to the contractors and the entire team for a job seemingly well done. So I want to congratulate you on that aspect. What I want to ask you, because of St. Catherine Chamber of Commerce represents the business community, how much have the contractors on the job itself interacted with the community, business community, to be participating in the possibility of contracts, jobs, that sort of thing? That I want to know how well that has gone, or if even at all we have been integrated into the system of supplies, that sort of thing.
All right. We have upstage the contractor with us. So I'm going to ask the contractor to respond directly to your questions because he's the one that does all the procurement of the material for the site.
It's on?
So we have an interpreter who is going to get the answer, and he will relay the answers to you.
Pertaining, good afternoon. Pertaining the Spanish Town Hospital, all the material, the raw materials for construction, cement, steel, blocks, were all locally sourced from places like Phil's, Clive Black Hardware, and surrounding hardwares.
And what about the jobs from the locals?
What, pardon?
The local jobs, like the contractors, the subcontractors, masons, carpenters, that sort of thing.
Where locals are concerned, we mainly employ laborers for our side.
Okay. Not here. Okay, so they have been part of the whole system.
Yes, and also on our supervision team, it's completely locals.
Well, that's good to hear. But I just want to say to the administration that being out there on the ground, I think Sarah has been doing an extremely good job, and I think you're not advertising. We only hear the negative part of what is happening, especially with Spanish Town Hospital. I see the CEO is here, but I think we need to ramp up when the good things happen. We're not hearing it. Because I was talking to a German who is Jamaican. She lives in Germany, but she comes here on a regular basis. She used to go to the private doctor for her health care with diabetes, and she has cancer and all of that sort of thing. She's in Kitson Town, and she said that she has given up her private doctors to start going to the health center. And I thought that was stupendous, actually, because she has what it takes. She can go to the private doctor. But she said the quality of service that she's getting from the health center is extremely good, that she would stay here more often now than going to Germany. And I'm just saying to you, you need some testimonials like this to ensure that Jamaica, we get too much bad name, and sometimes, even in St. Catherine, I like hear people talk bad about St. Catherine, and the hospital gets a bad name. But I'm just saying that you have people out there that gives kudos to what is happening here in Spanish Town and in Jamaica. So congratulations, and keep ramping it up.
So if I may, you had mentioned that you passed the site and there's not much excitement going on. But just to tell you that we have now reached over 400 working days without any incident on that site. Right? Right. Additionally, for all our program that is now in construction, we have surpassed over 500,000 man-hours without any accident. So we do have a very strict environmental and safety management system on all of these project sites.
I think this is an experience that should be replicated in the entire Jamaica and probably Caribbean. It's tremendous, and you ought to be given a tremendous round of applause for what is happening. It speaks to the fact that we have local people that can do the job.
Amen. I agree with you, sir. And well said. Lots of things to celebrate. While Mr. Messi comes to the mic, Mr. Shaw, I think just on the same vein, just since you've been at the microphone, and you started answering because you told us greater than 400 man-hours without incidents. I think that is extremely commendable, because I know that that was one of the issues that we actually, in terms of risk mitigation and risk planning, that was something that would have come into that matrix. But from an infrastructure investment perspective, what key milestones have already been secured, and what should residents expect next? So give us some more of the good stuff. What milestones have been achieved so far?
Thank you for that question. But just before I answer, those 400 days without any incident is also attributed to those two personal safety officers that are sitting right there now, and they're the one that ensure.
Stand up, let us see you. We have any prize for them? Any bag, any cup? No more. Any pen? But thank you so much. I mean, we do believe in praise and honor where it should be given, and everybody has such an important role to play. So we really thank you for all that you have done to contribute to the success. Mr. Shaw?
Right. So as it relates to milestone, you would have heard before in the presentation that we are going to be handing over some of the facilities by 2026. So that is really where we are now in the program. We are moving from physical infrastructure works to actually planning handover to the authorities. So that is for us a very key milestone in the program itself, by handing over the completed facilities.
Amen. And that's what we want to see too. We want to see the end product, because sometimes around Jamaica, a lot of half-built structures. And so we really love looking forward to the completion. And we know, based on what Mrs. Fritz said, we're holding it to it. 2026 for 3 and 2027 for Spanish Town Hospital. Mr. Messi, forgive me for calling you that, but go ahead, please.
Good afternoon. Delroy Scott is my name, and I am from the nicest community to live in Spanish Town. That's where I live. And I see some of the members of my community here as well. I'll tell you off the air which community that is. But I don't know if I heard if it was said before I came, but I just want to know specifically if there will be a dialysis center at this new facility, the hospital.
Maybe I could start the ball rolling.
Right. So as I understand it just now, there is a dialysis center at the hospital already. Yes.
Yes, our dialysis center is called the Ernest Ho Dialysis Center. It's been open, I believe, since maybe about 2016, 2015. And we are doing roughly over 6,000 dialysis sessions per year. And we have at least 80 persons on our list who come every week, 3 times a week, to get their dialysis. We're looking forward to expansion too, but that's not a part of this project. But we're doing good things. And of course, we can do more. We have a lot of patients, unfortunately, with chronic kidney disease. But we do have a dialysis center, one of 5 in Jamaica. And we're very happy as one of our achievements at Spanish Town Hospital. So just to update you on that. But we hope that we will get some more, because we would love to. Right now we can dialyze, let us say, 10 persons on the floor at a time. We want to get to a point that we can dialyze up to 30. But HSSP wants to control the chronic diseases, get you better, so hopefully we'll have less and less persons coming for dialysis. Is that Ghana? Country? The flag?
This flag?
Yeah.
Oh, it's a Jamaican flag.
Is that Jamaica? Okay, red, green, and gold. All right, but I think that's the Ghana colors. You have another question?
Oh, some persons wanted to know the best community is El Prado Verde, just off the bypass.
Yeah, yeah. No, I love the charity.
Sir, Mr.
Good evening, everyone.
Rastaman.
Is working? Hello, hello. Okay. Good afternoon, everyone. I am Dr. Clinton Daly. I represent the best community in Spanish Town. So, Mr. Messi, we have a problem here, right? So, like what Mr. Rubadam said, we are truly excited about this project, especially serving our community at De La Vega City. As you might know, there's an aging of Jamaica population, so we have a significant amount of new seniors in the community, really a larger proportion. And for people with chronic illnesses, especially for the hospital, it's for the health center, we are just really ecstatic about it. But we do have some challenges though, because many of the residents are especially close to the cement center, the cement factory. They have been reporting an increase in respiratory, asthma-related illnesses. So we, as a community, would love to see how we could work together to reduce the impact. And we are certainly excited about what's going on, but we are also concerned about that impact. Sorry, Mr. Robotham, but we hate to have a negative perspective, but it's not. We certainly are excited about what's going on, but there are some challenges on our side. So we want some direction in terms of how we could help reduce that impact. All right? Thank you. Where is the moderator? And when I mean respiratory, I'm talking about the dust. When the cement trucks are moving through the community, there's just a lot of dust. The road is really in a really bad situation. So we would like to work together to reduce that impact.
All right, so dust mitigation, who is going to, Mr. Shaw? That's you?
Yeah, so we do have a strict environmental plan that is being conducted on site. And our environmental and safety officers, ensure that at all times that the dust nuisance, noise nuisance, and any vibration, those are suppressed or mitigated in whatever way possible. Obviously, we cannot eliminate dust, we cannot eliminate vibration, we cannot eliminate noise, because the tractors are there, dust are there. But at all times, we ensure that whenever the work is going on, the dust, nuisance is, suppressed. Just to give you an example, whenever we are having pour of concrete, you will notice that at no time when the truck leaves the site, there's not any mud on the road there. If the trucks are washed before they go back on the road, and if there's any mud on the road, the contractor will, quickly, clean it up. We do have monitors on the site to ensure that the dust, that is being generated is suppressed as soon as possible. We do have tarpaulins that we covered the mall and stuff like that in case of heavy wind. So we do have a strict environmental plan that anything that relates to dust, noise, vibration, and any other thing are quickly suppressed or mitigated during the construction.
Yes, I'm thankful of that, but clearly the problem still exists. So we'd like to, maybe meet, maybe have a conversation to see what more can be done to mitigate. Because we do have some residents having some challenges. So, yeah, churches, school, residents, and so on. So again, we are certainly not against this project, but we would love to see what else can be done. And I suspect most of the dust is coming from, not from the work site, but maybe from your supplier site, which is the cement factory, I suppose, and which is close by. And I suspect that's where most of the dust is coming from. So the residents are a little concerned, and I know you have a plan in place, but we certainly like to maybe have some discussions how we can maybe improve the mitigation process.
Okay, I am going to ask our social...
I can hear that this is bringing a lot of conversation. I hear lots of talking, but Mr. Robothon, you wanted to...
Regarding that dust nuisance, because our church is right beside the community. There's a site that manufactures some concrete thing, I don't know, and they are creating some excessive dust to some amount that is really needs the environmental aspect to deal with. I don't think it is from the hospital. I am almost positive it is from that thing right beside our church. And we have spoken to them. We are about to bring our lawyers on them because they need to deal with and the environment aspect of it, NEPA, to deal with it. Because I think Pastor spoke to you where I think there is where the problem is. Not there, I'm not thinking.
All right, thank you so much, because that's what we want to hear. We want to hear the concerns. I know we're going to give contact so that the discussion can continue hereafter. But actually working daily at Spanish Town Hospital, because I'm there, we're not experiencing significant dust impact. And I must even say to the vibration, we don't feel anything at all, with all the work and reaching to the fourth story. So, but I know that Mr. Shaw would love to engage you some more to see how we can tackle that problem together. So, Mr. Shaw, anything else?
Right, just to confirm, we do not manufacture cement anywhere on the site. So, any cement that we use are actually those that which is carried to the site by premix, and we do have some mixing of cement just for block work, but no manufactured cement that would cause that significant dust that you spoke about.
But really, thank you. We want to hear all the concerns that you have. So we appreciate very much your question. I think you are on the same topic, because we might have to have part two for the town hall.
I am, good evening. I am Councillor Enos Lawrence. And it would be remiss of me not to say something related to this issue. That issue, I have spoken to the public health inspector, St. Catherine. She's Mrs. Douglas. She's fully aware of what is taking place there. And I hope that even hearing this from residents, if you guys would even do some investigation to assist in terms of alleviating that problem. Because it has to do with the public health department that house over by the office there. Secondly, in terms of the site, it so happened that I was recommended as the project, the liaison officers with the Chinese on that project. I would like to really say that as it relates to the females, a lot of females in and around the community is really upset that they were not given any chance of employment. I made the representation to the Chinese, but they said, no, no female, right? And it's just like that. And I want to also point out that in and around Spanish Town, we have a lot of great skilled men and skilled women. We have skilled people in and around this area. And all the work, as it relates to that, goes to the Chinese. And try as we may, them not even paying us much attention as it relates to that. And although I really commend all that is taking place, and I am glad for the development, and I commend all the organizers for this function, I would just want you to know that there is displeasure by some of our citizens, that especially the female does not get a chance to get any employment on this project.
Mr. Shaw, is that for you? Want to be a little bit more inclusive, they say, of the females. Is that? So you want to see more women lifting operating the cranes and dropping the cement? And so we just wait until the translation takes place.
Mr. Lawrence, currently on the side, we have 2 females. One of them is in charge of auxiliary cleaning the offices and the kitchen, and the other one, she works in the kitchen with the chef. You said they tell you no. Who told you no? No, but you said you were told no. So
Consular.
I understand. That is true. I understand that. But I'm asking.
Consular.
When were you told no?
Consular.
Along with our safety officer, who is also female.
1 minute. I think, ladies and gentlemen, good afternoon. And thank you for being such a wonderful audience. Now, what the consular is saying is a concern for most persons. So what we will do, now that it has been raised in this forum, we will have to establish special mechanism to treat with that, because that is also a very important standard for the program. And Consular is very passionate, and we have to really address the situation. It might not be resolved in this particular setting. However, we have to listen to what is being said and find the time to treat with that. Okay?
Nobody don't try to penalize me for what I am concerned that I am.
Not at all, sir. I think every question, every comment, every concern is valid and valuable. And I know that there will be opportunity hereafter, Councillor, to engage you some more. But your point is heard and definitely well noted. And we will follow up with you on that. Yes, that's true. That's true. So we really understand your point, and we'll take it from there. You wanted to respond?
Good night. Good evening. I'm from
We want to wrap up in 10 minutes.
I'm from CCECC. And the
What's
reason
your
why...
name, sir? What's your name?
My name is Eugene Gordon.
Gordon?
MEP engineer from CCECC. What has happened in the past is that most of the female that attend the site cannot do the work that men. That's why we don't order the females. The site is small to facilitate more than one female. So that is one of the reasons. Now we're in Portmore. We have some electricians that are females, and they are working on the site now. So if there is an electrician or means that's a female and wants a job, they will assist the Chinese. And that is what we are doing now in Portmore.
All right. Thank you so much, sir, for your response. We're going to move on, but the point is well noted in terms of gender equality and opportunities for the thing. So we take your words, young lady, and we will... Okay, no, well, I think they had said there was a mixture. So this is what we wanted today, actually, a very robust, interactive, and open and respectful discussion. So we thank you all so far for all that you have said. Sir Bishop, you have been waiting a very long
yes,
time.
a
Go
long,
ahead, please.
long
On your
time.
legs.
But nonetheless, Junior Headlam, also the chairman of the St. Catherine Parish Development Committee. And two things. One, I kind of raised this at the Old Harbor Town Hall meeting, but I wanted to raise it here again. I wanted to raise it here again regarding, and I think someone spoke about the Linstead Health Center, just to make sure that with all the developments that's happening, we do not neglect those other health facilities in the parish, because we all know that commute from some of our communities and districts to some of these mega and nice facilities could mean a matter of life and death. So we do need to pay some attention to those as well. But also, and I listened to the minister earlier and several other persons have spoken about it as well, the quality of service that should be expected in these facilities. And I want to find out what exactly is being done to ensure that the quality of service is being prepared for this new facility that we're speaking about. So I'd like to hear some more about the preparations being done with our
That
our
sounds
workers.
like Dr. Prosper Chen. So you can even add to that, what improvements can residents expect in wait times? We don't want to wait too long when we come. Referrals, specialized services, once the center is operational. So I'm just piggybacking on Bishop's question. Over to you, Doc.
But Bishop, you spoke to the quality of service. Okay. So at the St. Jacob Park, we will have an expanded curative service. All the other services, for example, the X-ray will still be at the hospital, but we do have that referral to send patients there. The mental health, we are expanding that service so it's more comfortable, including our dental oral health service. So that also will be expanded. If we want to talk about the quality now, we are going to employ, and we have two so far employed, customer service representatives. And they now will guide persons through the facility toward the service that they're there for and ensure that they get through and the service that they come for is exactly what they got. So we're hoping with the additional customer service representatives, with the training of our doctors in the whole concept of service across the life course, meaning that every interaction with any of the clinicians or the nurses, anyone in the health center, should be based on your age, where you are in life, whether you are the child, the adolescent, the young adult, the older adult, that consideration is given when you go to the health center. We already have a limited staggering of the appointment system, so that we will continue and probably concretize it a bit more so that everybody does not get the same time and end up at the health center at 8 o'clock and know that if you come at 8, you're not going to get through until midday. So we are trying to prevent those types of long wait hours. Long wait hours also depends on how many persons we have working. Our biggest shortage is with nursing. And so we are going to employ more nurses so that we can move persons quicker through the health center, and that services such as dressings and wound management will be adequately addressed. So But not only are we looking at the facility and its beautifulness, we are also looking at how we make the service better.
Thank you so much.
Those go hand in hand.
Thank you, Doug, because you hear that it's not just about the building. We want to hear that the quality of the care and how the compassionate care is improved. So a final question for you, Doug, from a public health perspective. How will this project strengthen emergency response and community health outcomes? I know you're a public health specialist.
We are improving if we talk to emergency response within the health centers, then we are improving not just the capacity of our doctors to respond, but also the infrastructure. So equipment and supplies will also be improved so that they can respond to the emergency in the health center. We are always responsive to emergencies outside, whether it is to an outbreak, whether it is to some new event that we need to respond to. We are always training our staff so that they are able to quickly and efficiently respond to those types of environmental emergencies. We have our public health inspectors on the ground, and they are very responsive to these things. So I think we are always in that process to train and to improve our service. Thank you.
I think that heightened a little question. We just crave your little patience. You've been there a little bit, but this is just related to that. And then over to you, sir. So you next. Boy, I tell you, we need part 2. But Assistant Superintendent Dunkley, I think just a quick, short, 15-second question to Dr. Prosper J.
Good afternoon, everyone. Good afternoon, panel. The name is Everton Dunkley, Assistant Superintendent, Jamaica Fire Brigade. My question is all about safety and the whole aspect of integration with the fire department itself as it relates to inspection processes. I'm asking at this point in time for invitation to be sent to the fire department to come and visit the site itself so we can check up on the whole aspect of the safety. Thank you.
Thank you for that question.
Thank you for that question. Surely, at that point when we start to install the fire suppression system, the fire brigade will be invited, and we welcome you at any time to visit the site just to check on what is going on, because we know that at the end of it, we have to rely on you to come and inspect and give your approval for what is there. So we definitely be working with you to that everything that is installed as it relates to the fire safety will be installed as per your approval.
Thank you, Madam Chairman. Linda Douglas, a Justice of the Peace and an educator. Once an educator, always an educator. I know we would all agree that the project that is going on there is a world-class project. And it is therefore my concern, and I'm sure other persons' concern, that it can be a teaching tool. So to what extent did you invite or whatever, persons from tertiary, secondary, and so institutions to visit the project to see and learn about your building techniques? And the other question is, could you kindly repeat, Madam Chairman, the partnership that have put together this great project? Because we should never not remember people who give us such great help in our lives. Thank you.
Yes, collaboration is key. We can't do it without our sponsors. IDB, European Union, who is going to take that question about inviting the church or Madam Teacher JP. Ms. Frith? Mrs. Frith, you want to take?
thank you for that. I mean, before the project would have consulted, but I think it is important to talk about the important partnership that we have with the Social Development Commission in terms of the engagement plans and how that would lead to those kinds of suggestions and initiatives. I'm going to hand over to our panelists.
And at the same time,
Our
just tell us
director.
what channels the residents have to stay informed and raise questions after tonight's town hall. And then, Mr. Gentleman, I have to find a prize for you because you've been on your feet. Please find a prize for Mr. For his patience. But go ahead. Thank you so much.
All right, so good afternoon, everyone. We have many different channels that we use to inform the public. This event today is one such channel in terms of town hall meetings and town hall sessions. We actually also go to the facility and do engagement sessions there. We would have done an engagement survey. We would have looked at all the communities surrounding the facility, received their perspective. So we'll be sharing that report shortly with our partners, and we'll be having many other such community-wide events at the facility itself as around the facility. So there are multiple channels that we'll be using. We use flyers, brochures, events, surveys, go into the facility, talk to the man on the corner, go to communities, go to the homes, talk to our partners and engage our stakeholders. And it continues after today. So if there are questions for us, feel free to contact us at the Social Development Commission and we'll ensure that the HSSP receives the questions.
Okay, beautiful.
And the answers.
Thank you so much, because communication is a very, very important part and engagement of the community for the success of this project. So we're happy for that opportunity. I know this is not the last town hall, although we hear 2026 as a timeline, but we know that this is not. This has been one of many.
One
and
of
this
many.
certainly
Yes.
will
So
not be the
we
last.
would have had town hall at each of the different facilities. So this is the final in the first round.
Oh, fine.
In the first round.
In round
But
one.
Right, but before the facilities are opened, and we know that the health centers will be open this year, 2026, so we'll be having major, what we call health extravaganza, where we'll be having wide community activities mixed with fun, and we'll ensure that all of our stakeholders, not just the communities, that they are aware.
And I know there's opportunity for one.
And I'm a president of the Ensom City CDC. Now, from the football or the sporting facility point of view, we are grateful. The prison oval is just across the road from the hospital, and from time to time we might have Messi getting injured, and we have to rush him across here. And on occasions, we've had where persons have been waiting in the A&E for hours and hours, and unfortunately, they have to move them from there to a private facility to get treatment. So we are really excited that the hospital is improving, and we hope that in the future, quicker and swifter, turnaround time can be had from the A&E, especially, right, for those trauma incidents. Now, from the community perspective, I'm also a CDC president, and Ensom City had benefited from a research that UMONA was doing with some of our aging residents. Now, we've noticed that there's a lot of dementia, there's a lot of stroke within the community, and I've had in my family where I've had to carry persons to the Spanish Town Hospital for physiotherapy and all of that. What I've noticed is that it's like the facility is too small for the need right now. And I'm hoping that there's an expansion on the stroke treatment or, for patients there, and also dementia. We've had it in the community where a number of persons, they don't know where to go for dementia treatment, speech therapists and all of those things. I don't know if that's a part of the consideration for the hospital in the expansion. But that's my contribution, and keep up the good work, and we're looking forward to the opening.
Just one thing, Madam Chair. I just want clarity.
10 seconds.
That this kind of project needs to involve our learners. The technical department of the schools, the University of Technology and those institutions.
Teacher at heart, teacher at heart. Who is taking that? That sounds like Miss Shireen. Any comment to make on that?
Hello, Miss. Good day. Currently, there are a few UTech students, and I know of one student from VTDI who visits the site maybe every 2 to 3 weeks. So there are, I understand that, but at the moment there are people who come on the site, they ask questions, and we're always receptive to answer those questions. Yes.
Once a teacher, always a teacher. Always. Learning is the future, you know, because if we don't teach, there'll be no future. So we thank you for that question, and I think we're ending on a very good note. I think our panelists have been great. And just finally, Mrs. Frith, what verified channels will residents touch on that? What verified channels will residents be able to use for updates apart from the townhouses? Is there any site that they can go to, or what channels are there for them to just keep up to date? Whether Shireen or Mrs. Frith, yes.
Yeah, well, we have the traditional media, we have the HSSP communications, we have the non-traditional channels, and importantly, because we are talking about connecting, relationship building in the community, we have our important partnership with the Social Development Commission, who is carrying out engagement plans. We have developed an engagement plan to look at various ways in which we connect with the community for them to be kept abreast of the project and the progress that we're making. Of course, we have our communication specialists, we have our social specialists, and those persons are using various platforms. We have our website, we have other communication, the things that you get here today, our official channels, and so we encourage you to use them. We encourage the community to come out where they are invited to hear about the progress, and that's pretty much it. We really thank you for the partnership with the Social Development Commission. We're in the SDC complex, and the SDC is playing a critical role to build lives and build communities. And this is what this is about. Even what you have said concerning learning opportunities, those are things we have to look at in terms of our engagement plan for the community. So we encourage you to use the official communication channels to keep abreast of this program.
Lovely, lovely, lovely all around. So thank you so much to our most able panelists. It's always about engagement and asking the questions, stirring up the little, you want to, Dr. Prosper Chen, so go right ahead.
For the gentleman who was concerned about our elderly with dementia, there is a program that's being developed, the Elderly Health Program by the Ministry of Health. And so it is targeting persons with dementia and other illnesses related to their age. So that is coming online. Probably by next year we might have a pilot, so that should be very exciting. So it's coming.
All right, thank you. So I believe that we have done justice to the time. We are getting out of here because we don't see any screen changing to at One Spot Media or what are the other areas, TVJ, that we can get the match. So we thank you so much to our panelists. I certainly join me in thanking them for answering our questions, listening to our thoughts. It's not just questions, but it's comments, it's opinions. And certainly we heard quite a lot today. The noise mitigation, the dust mitigation. Sir, Mr. Robotham promises to engage some more on that. He believes there's another source to the much dust. And don't forget the Sahara dust is also a part of it, and the whole global warming. So many things. Dr. Prosper Chen, thank you for just, encouraging us and really giving us the confidence that it's not just about the infrastructure, but it's also about the quality. That is just so important. Sometimes it's better you come to a old rundown house, but you're getting quality. But we want to do both at the same time. And Mr. Robotham, the testimonials are out there. We do know that if it's one person who has a bad experience, we want to improve that experience for the person. But out of the 100, we may find 80, 85 who have testimonials to give. But it's about quality improvement and the compassionate care, our parish manager's baby. Compassionate care. You hear the minister with it always. But it's about the quality of care. It's about quality improvement. And we thank you, Councillor, for your thoughts on the gender inclusion. We did answer to some extent. You don't seem too satisfied. But there are channels and there will be opportunities outside of this forum to address that. 2026, October is very near. So one aspect of the project will be finished. And we're grateful for the milestones. We're grateful for the incident-free. We're thankful for every member of the community or environmental specialist. And this project just shows you how every person, I remember my son saying, Mommy, everybody doesn't have to be a doctor. Everybody doesn't have to be a doctor, but everybody is important in terms of contributing to the success of this project. And we thank you to environmental specialists for keeping us safe, keeping us under control. It also cuts down on the inputs to Spanish Town Hospital, because if they get injured, we may see them in our A&E department. So thank you very much for answering all our questions. We know it's a stable structure. We didn't get into that, because sometimes the question comes about, what strength of disaster can it withstand? And I know that our construction company has also taken that into consideration. I remember Hurricane Melissa coming, and everybody was worried about the cranes. And trust me, I was on the compound during Hurricane Melissa, and those cranes never moved. When the zinc was lifting off, when the trees were dropping down, the crane stood still. And I think that's testimony to what the construction company is doing, and the physics and the maths and everything that has put into it. So to my able panelists, if you wish to get up, you can. Stretch your feet. You have been sitting. We know about chronic care and connecting. But ladies and gentlemen, we could be here until the sun sets. But all good things must come to an end. They have to. We can't sit here forever. We need them to go back and finish the building in the timeline. But we thank you for your engagement. We thank you for your interactive nature. You may not have been able to ask every single question, to address every controversy, every opportunity, but I think we got a fair chance to do likewise. So I'm excited. I don't know if you are. I know you're tired, so you don't look so strong again, but I am very excited about the next chapter in our future, and I'm certainly looking forward to us getting to the end of this road, and that will be an all-inclusive package. So we look forward to the future with delight. We look forward to the future with expectancy, and I mean, success comes with support and collaboration and inclusion of everybody here that's here today. So thank you to our able community. Go and spread the news. Maybe you can have your own little forums and say, boy, I attended a town hall, and these are some of the areas they address. So do your own things in your own spaces, in your own communities, and there are channels that you can go to get some of the answers. So thank you very again. Special thanks to the ministry. Oh, Mr. IT, you are still. Oh, my mic turned off because Mr. IT is here to come and take over master moderator. I mean, I certainly can't live up to his shoes, but special thanks to the Ministry of Health and Wellness and to all of you that are here, and for those who have lasted the end of this town hall. Mr. IT, you're going to entertain us? You're going to give us a few words?
I want to thank you. She's just being shy because I'm about to introduce her so you can see the talent that she possesses. Listen, there's a dance she's about to display. Nobody's ever seen it before. It's she alone know it, and she can really see. Please give Dr. another round of applause for the presentation that she carried on today. Wonderful. Now, I want to wrap in a particular way. I want to know though, is there anybody here who is celebrating a birthday this year? I do. Well, me have to check, Me have to check. Hold on. Yes. Reset for me now, please. Wonderful. No, let's come back here. There's a lady. No, hold on, man. There's a lady here who's celebrating a birthday this year, and I want you to sing her happy birthday or she feels special. Just pick her. See there? What? Okay, come here, my dear. What's your name?
What's her name?
Yes, you know her name?
I don't know her name.
My friend, he's called on you, yes. Yeah, in no matter, I said this year, in no matter when this year. It's Allison. Allison. What is your name?
Clinton Daly.
Come here, Allison. Allison, when was your birthday?
March.
March? All right, we're going to role play. Go on like a today birthday. And him say, and him going to sing happy birthday to you. Now, I want you to sing happy birthday, you know, makes you feel special. Ladies and gentlemen, are you ready?
What if I can't sing?
First person, come check me. Yes, nice. See a lady here. So you never, what is your name? What is your name? Come here, I'm talking to you. What is your name?
Miss Nicola Larry.
Miss Nicola, and you say you never win nothing in your life. Don't come talk to me. Eh? You have the buckle and you're up here.
Please remember, I'm a safety officer, so I have to keep it safe. So having my hands full, it will be a hazard to me. So I have to secure the unsafe act in the bag.
She explained herself, good on? Give her an applause. No, you have one for yourself, an all expense paid trip back to your seat. Give her an applause. Make way for the fitness trainer, ZYDON, we call him Zidon. Put your hands together for Zidon, get ready. All right now.
All right, everybody, how you feeling? If you feel good, you should be standing. Do me a nice favor and stand to your feet. You guys been sitting for very long. Stand up with me. We're gonna do some nice little moves. Ready? All right, let's breathe in. And out. In again. And out. Nice. Hands up. And I swing from side to side. Just like that. Nice. Nice. Now we go. Walk with me. Nice. Step. 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 You can move with it. 1 and 2. And a 1. And a 2. And a 1. And 2. Nice. Same way. Look good. That's it. Same way. Step cross. Now we add. Hands. And hand. And hands. Nice. Same way. You like to move it. And then you kick it out. Kick it. Nice. You better move it. You better move it. Nice. They can dance, right? That's it. Same way. Look good. Smile, no man. You're at the end of the day. Feel good. And there we go. And up. Straight up. Look good. That nice. Same way. Boy. Nice. Straight cross now. Nice. Reach and twist. Square engage. Nice. 3, 2. Bring it low now. Bring it low. If I can wheelie bunks, look at start it. Nice. Same way. Boy. And then we twist it. And if you can, let's do the hokey pokey. You have it? Go down with it. Down there. Bring it up now. Down there again. Nice. Come back up now. Nice. And then you kick it back. Like this, like this, like this, like this, like this, like this. Nice. Uh-huh. Walk it out, walk it out, walk it, walk it. Now we're gonna get, I need 4 steps from you. 2 front, 2 back. 1, 2, 3, 4, forward, and back, and forward, and back. Same way. Nice. Step it out. Uh-huh, uh-huh. Enjoy it, man. Yeah, yeah. I like how you dip with it, you know. And dip with it. And dip, go back. Nice. And dip, go back. That is it. Dip, go back now. Nice. Same way. Walk it out. Woo. Woo. Uh-huh. How we feeling? Nice, nice, nice. So, just as much as good things are coming to ending, we're going to do a nice cool down. If you play the Michael Jackson, the DJ, we're going to do more moves. So, let's take it down. Let's rotate the ankles. Nice. Switch directions. Nice. We're switching legs. Next leg. Lovely. Switch directions. Nice. Now, I want you to put one of your hands all the way up in the air. And the opposite leg, I want you to hold it like this. It's not punishment, it's not class. I know I'm bringing back the traumas from the classroom. Next side. 3, 2, 1. Bring it down. All right, hands up. Give me a little width in your stance. And then touch the ground. And keep it there. 5, 4, 3, 2, 1. Up. Nice. And then hands out. Then we go over. Hold it. 5, 4, 3, 2, 1. Next side. Look good. 5, 4, 3, 2, 1. Now rotate the wrist. 3, 2. Switch directions. Nice. 2, 3. No. Hug up yourself. Self-love is important. Nice. Now squeeze yourself like you love yourself. And rock from side to side. We can't sing Silent Night, don't worry. All right. Touch the back of your neck and then hold the elbow. 3, 2, 1. Switch sides. 3, 2, 1. Hands down. Now we rotate the shoulders back. Nice. Bring them forward. Yeah, this might mess with the coordination a bit, but you got this. You got this. Nice. Now I want you to put one of your hand on the opposite side of your head, touch your next ears, and pull. Don't break your neck, please. I know we're at a health center, but just don't do that right now. Next side. Keep it there. Why your neck looks so... You have whole heap of neck flexibility, man. All right. Let's breathe in. Hold it. Hold it. And out. In again. Slowly let it out. Now I want you to give me the deepest one ever. Right down. And come up. Everything, everything. Hold it. Hold it. Slowly let it out. One more time. Let's do that again. Hold it. And let it out. All right. How you feeling? Lovely stuff. So you can't say you never hit any day on a high note. So, walk good. Take your time. Stay healthy and hydrated. My name is Zidane Malcolm, and it was my pleasure to be here today. And what she say, eat healthy? Yeah. Eat healthy, please. The lines are long. If you have patience to join the lines, you have patience to cook.
All right, good afternoon, everyone. We have meals as you're exiting, but for the persons on staff from HSSP, MOH, we have meals inside the conference room. So please do not leave without collecting your meals. Thank you.